first with Jude Bueno de Mesquita, then we're going to go to Joe Viry, and then we're going to go to Professor Michael Knipper. So let me introduce them briefly. Dr. Judith Bueno de Mesquita is a senior lecturer in international human rights law at Essex School of Law and Human Rights Centre, with over 2 decades working at the intersection of international human rights law and global public health. Her current research focuses on food systems, climate change, health, and rights, as well as post-growth approaches and their human rights implications. Seems like your current research is very timely. Next, we have Dr. Joe Viry, who is an associate professor and director of the African Center for Migration and Society at Wits University. So she is actually the person coming from the furthest, so thank you. She has a background in public health, and her interdisciplinary research focuses on the intersections between migration and health. She directs the African Research Universities Alliance Center of Excellence in Migration and Mobility, and is co-lead of the ARUA Guild Cluster of Research Excellence in Migration and Health. Jo is committed to social justice, and we look forward to hearing from her soon. Professor Michael Knipper, MD, is a professor of global health, migration, and medical humanities at Gießen University in Germany. He's a physician, a medical historian, and anthropologist. So without further ado, I'm going to turn over to Jude.
Thank you so much, Carla. Thank you, Anuj, and Colin, and Amelia Presley for your excellent opening panel. So I'd like to preface my remarks by saying that unfortunately, I don't think I'm the best person to give this talk. I've grown up in a global north country, a former colonial and remaining neo-colonial power in a position of relative privilege. I've been educated in a system which has certain biases, and in institutions with colonial histories like Cambridge University and the London School of Hygiene and Tropical Medicine. Luckily, Essex has been established a bit more recently than that. And much of my career has been working in global public health at the international level with international institutions and academic spaces in both contexts, rather dominated by global north practitioners and scholars. And often discussions do reflect these concerns. At the same time, I feel very privileged to have had some educational opportunities and professional opportunities to work with alongside amazing activists and scholars from around the world who've really opened up my eyes, and I've always tried to learn and to listen. And I think really beyond everything else, I want to give credit to our excellent students at Essex University and the amazing experience of teaching or really actually learning in classrooms for 20 years through really wonderful discussions where people felt open and comfortable in sharing experiences and different perspectives. And I hope that that's not something that will change in this current day and age, as well as working with wonderful colleagues. So I do feel a bit nervous making these remarks. I'm not a decolonial scholar at an explicit level, although in some ways, what I believe in certainly aligns with these schools of thought. My remarks are going to be quite narrative and based partly on personal experiences and reflections combined from learnings from readings and exchanges with others, but all errors are my own. I do apologise for reading notes. It's not my normal way of presenting, but just I did feel a bit more comfortable doing it this time around. So to take us back to this global health context, I'm going to say a couple of things which Anuj had mentioned at the outset. I mean, really, global health has been in crisis for many years, but this sort of crisis we have now is a slightly different one. It's a deepening of a funding crisis, which really threatens to undo years of good cooperation in fighting shared health threats in a globalized world. So this has been most precipitated by US funding cuts, including the winding down of US aid and federal aid budget cuts. Thousands of aid contracts have been terminated already. At a per capita level, the US aid financing is comparatively limited, as in the amount that goes from each person, but it is by some margin the biggest donor in the field of global health in absolute terms, which is why these decisions are so significant. But equally, other traditional global north donors have also been winding down their aid, including in global health. So the UK is almost halving its aid contributions in the coming years, having already been reducing them recently since about 2020, while other countries like France and Germany are also reducing their aid, looking to sort of ramping up military defense budgets as well. So there's been a big Western retreat from aid in particular. And while the aid no longer follows the North-South stereotype with the rise of other donors, including the BRICS countries, as well as South-South cooperation and other non-state funding bodies, the cuts still represent a big blow in financial terms to global health and to individuals and communities around the world. So that the implications are really serious and will affect the health and well-being of millions around the world. Last month, Dr. Tedros drew attention to impacts in fighting diseases such as HIV and malaria and measles. So there's already been impacts on access to antiretroviral medicines in 50 countries on malaria vaccination trials. And there's an estimate that cuts to aid would lead to more than an additional 15 million cases of malaria and 107,000 deaths around the world. We've also, of course, seen the reinstatement of the global gag rule undermining women and girls' sex and reproductive health and rights. Further defunding the WHO itself and the US withdrawal from the organization has serious consequences for global health cooperation, developing technical guidance and international standards and agreements for cooperation, as well as for monitoring things like emerging disease threats. Quite a lot of the articles that I've come across around the US withdrawal from WHO focus on the impact of the US in terms of global influence and public health within the US, but there are broader threats to lives and equity. While my remarks focus on global health, I also wish to acknowledge the horror of Gaza, the blocking of aid, the killing of aid workers and medics, as well as civilians, and the banning of UNRWA, and the failure of Western powers to stand up to these horrors, acknowledging that WHO itself has been quite an outspoken voice against in this context. So there's been much discussion about whether this crisis represents some form of opportunity to restructure global health along other values, greater democracy, greater equity. And certainly current power politics that frame the field create an unequal world of influence, as well as extraction and inequality. And it's vital to address these. And there will be opportunities for new partnerships and mobilizations. And interestingly, some of the project work that I'm involved in, which involves universities and other partners in countries like Canada, Australia, South Africa, there's already been interesting discussions about maybe there'll be different opportunities for greater cooperation, trade, academic partnerships between these countries. So that was quite interesting to me that, scholars, Indigenous activists actually who are part of the project were already looking to perhaps some opportunities. But in the short term, there are problems in terms of sequencing and power vacuums. And there are opportunities for countries, particularly such as Russia and China, to step up. And whilst China has historically and still today played a critical role in global public health and itself has a long and important public health tradition domestically, there are concerns that I have in terms of things like equity and human rights, which it has not been traditionally a champion of. And it also has to be said on the public health front that in terms of its own international, political and economic ambitions, the way that health has been addressed in these contexts has not been ideal either. The other thing to add is the dismantling of aid leaves some of the more extractive and unbalanced facets of global public health in place, like IP protections under WTO rules and WTO plus agreements. TRIPS Plus agreements, as well as heavy levels of indebtedness. It has to be remembered that WHO was the actor calling for the end of global vaccine apartheid in this context. The retreat of aid and multilateralism must also be seen in the context of the rise of the private sector and naked capitalist values, which are deeply colonial in many ways. And here I just want to refer to really awful article headline in The Guardian yesterday, which terrifies me. The article headline was, "Climate crisis on track to destroy capitalism, warns top insurer. Action urgently needed to save the conditions under which markets and civilization itself can operate," says senior Allianz figure. And the world is suddenly more violent, unequal, with solidarity diminished, and with attacks on public health, evidence, and science. I also wanted to mention the broader attacks on work on justice, rights, and equality. Although rights can certainly be completely rightly critiqued as colonial and Western, they have also been part of some struggles against these inequalities, although they're not the only set of normative values and actions that are a part of these struggles, and they have their limitations. But their undoing is motivated by colonial and not anti-colonial intentions here. And just to mention one example, last year, an assistant professor at Columbia's Melman School of Public Health, Dr. Abdul Qayyum Ahmed, who taught human rights, had his appointment terminated, accused of radicalizing students after calling Israel a colonial settler state. So there are broader structural concerns that are at the heart of the problem, which are very much in evidence. So moving on from this, I want to reflect a little bit about WHO, about global public health. And I don't think I need to sort of go into the colonial origins of global public health. That will be quite known to most of the people in this room. But WHO was not established so much in that tradition. It was established at the time that many former colonized states gained their independence, and the movements fighting for independence were an important part of the movement fighting for and supporting the development of an organization like WHO, which was democratic. All states had a seat at the table. And the WHO constitution is very reflective of those values of equality. And over the years, WHO has pushed important agendas like the Alma-Ata Declaration, which follow within that tradition. WHO is an international organization, but it is quite decentralized as well. It has its regional offices, it has a strong country presence, so it's not just that sort of very, very top-down model. Ongoing colonialism in global health has many manifestations, and it's important to recognize that WHO is part of a much broader matrix of entities. And in and of itself, it has, I think, some problems in terms of its sort of colonial, question. It wasn't a question of expertise, although I didn't ever get a very clear answer from it. So that was one thing I found quite interesting and troubling. Another project which I worked on, have been working on is about infectious disease control, and it's particularly a project which has been has a very strong epidemiological slant to it. And the research on this project has been really amazing from very top epidemiologists and very thorough. But that's what it's all been based on. It hasn't been based on other important information and values about things like rights. There was nothing really considering experiences or knowledge of indigenous populations, although that could have been very, very valuable, and it just wasn't conceptualized within the design for the project. A third thing that I have found at WHO is that there's been historic neglect of issues connected to colonialism, as well as colonialism. Including in the work of WHO. There's also been a lack of attention to things like traditional medicine, to Indigenous people's knowledge systems. But I think in all of these areas, things have started to change, but there's still much further to go. Fourth element, so just very two last quick comments. WHO it's been quite problematic working on human rights at WHO over the years. And one thing that's been really interesting in the last few years is just how some of the conversations I've had with other people who've been doing this kind of work. So again, Anuj and I, we had with this project, we did this research for them, and then it never got published, right? So the research was quite good, I felt. It wasn't that we did a bad job. We didn't get published, and we never really kind of got beyond that. And the more I talk to people, the more I see other people have exactly the same experiences. So there's something that's going on within the structure, which is it's a very political organization. There's something that's going on in the structure of the organization which prevents them from actually publishing in this area. And one other example of that is I've had an article which was accepted provisionally with others by the World Health Bulletin on human rights, and it was pulled the week that Trump was elected. So yeah, someone said, well, you can read into that what you like, but we all know what's going on. And the fifth element, and I'll stop after this, is about democracy and participation. Is really, I mean, I've been shocked because in the world of human rights, there is a lot of participation, there's a lot of scope for civil society activists to get involved and to shape agendas. And that hasn't really been the case at WHO. And it's been very apparent in a number of fora, but particularly around the pandemic accord and the international health regulations revisions, how difficult it is for people who aren't states, non-state actors, to actually get involved. So that's my final comment, and I will hand over.
Thank you so much, Jude. We're going to turn directly now to Joe, who's going to take us further along this journey.
Yeah, I hope. Yeah, please give me a nudge, or I can maybe watch your. Okay. I've got some slides, maybe. Cool. So hi everyone. Yeah, I'm Joe. I've traveled from South Africa, but I've been in South Africa about 22 years now. I'm originally from the UK, so I sit in a position that Anuj and I often laugh about, the kind of opposite of each other in terms of identities and confusions around what does that mean. I also did my undergrad at Edinburgh, did my master's at the London School of Hygiene, then traveled to South Africa, did my PhD at Wits, where I still am now. And so you sit in these strange spaces where you are and aren't part of different conversations, and you do and don't have a place in them. And it's a very difficult terrain to navigate, but it's obviously an essential one to be participating in terms of supporting, in terms of engaging, but also knowing your own discomforts and trying to own those. And even being on this kind of a panel, right? You look at the title, you look at who's here, and you think, oh, I don't know, is this, it's a challenging space to work out how to curate different conversations. But what I'm going to do is sort of drawing on, or what I'm going to try and do, is drawing on South Africa, but also work that colleagues and myself are involved in, including with Anuj and the GEMS team here, looking at sort of intersections between histories of health and histories of the ways in which sort of health management, communicable disease management has been implemented, and the drivers behind that, with different movements in sort of so-called global health, and the ways in which we think about migrant bodies and the movement of people and the role of borders. So I had an image that brings us back to the point about Trump, which I would like to start with, but it'll come up at some point, I'm sure. So I'm not going to labor the point, but oh yeah, I didn't need to come up with any title, because Zapiro, some of you may know, is a South African cartoonist who is often bordering the edge of, I don't think he'll ever get into the US, but he'll probably never get into Europe either. So he's a very good political commentator. And this really has been the message that's been thrown down the throats of people in South Africa. And as of last week, with the NIH funding also being withdrawn, You know, we're now sat not only with disruption, which is actually abolition of very successful HIV programs, we're also now sat with all of the implications around the world of science and discovery. And if you think about the history of South Africa, unfortunately, because of HIV, it means that South Africa is a leader in viral research, virology. And when we look at what happened around COVID, it was South Africa that was mapping the virus, sharing the information straight away, was part of the first trials, yet one of the last to receive any benefit from that. So again, it's this completely contradictory space in whose lives matter at what point and to what benefit. So we know that when we think about sort of the field of sort of the drive towards international and global health, we know that they have emerged from sort of racist, separatist histories, where we've very much focused on, you know, the worlds of colonial, tropical, and missionary medicine. Can we go to the next slide, please? So we know that many of the debates and dialogues that we see sort of re-emerging, and we're trying to own more, but as a result, we're also running away from, I would argue, more, is around, just on the next slide, sorry, is around thinking about language, thinking about voice, thinking about representation, thinking about the ways in which different sort of geopolitical layers and spaces are given priority, which we know links to whose voice is the loudest, which is not necessarily ever actually the loudest voice. It's where the voice is given. And how do we navigate those between majority world and minority world spaces? We have to think about what this means for the ways in which the language of scapegoating has globally gained even more power. We know it's a cheap political tool that we see globally used in any national election or otherwise, but the speed at which this has sort of driven the current context in Europe, but also elsewhere, is very, very scary, as we know. But we need to also be owning that in the South African space that I'm the most familiar with, but also elsewhere. You don't always hear racism come up when you're talking in a global health space as determinants of health and well-being. It's hidden, it's there, and it depends on who's involved in that course. It's not that people don't recognize that. I think it's about what people are comfortable to sort of foreground and own in that space. And then importantly is this sort of world of competing agendas. And this is something we really all need to try and find ways to engage with differently. We need to recognize that on the one hand, we have this increasingly panicked, racist, nationalist world where immigration is ever more restricted. Our borders are physically bigger as well as administratively bigger. Separation between states is increasing in numerous ways. We then have the move towards universal health coverage. We have sustainable development goals. We have this whole idea that is driven from a public health imperative of the world we want. But those ambitions, and we can watch them, are eroded continuously by the premise from the space that we began. And I think that one of the ways that the South African space has been discussing the withdrawal of US funding is through the lens of global health targets, and really trying to argue very clearly that, well, we were starting to get to these ones, and now you've pulled this money out. So that's going to affect everybody. But we know that public health arguments and human rights arguments rarely win political change. And this is part of the challenge I think we sit with, is how do we bring colleagues working in the human rights space, colleagues working in the right to health space, programming around global health and public health, and how do we bring those issues together to benefit all? How much longer do I have? Okay, great. So we then have obviously issues around global health security, and it's probably the first time for many people globally that the word pandemic meant something, that the word kind of health security came up. And I know, as I'm sure many of you experienced, that that led to very strange conversations with people in my friendship family who I wouldn't previously have ever thought was sort of anti-movement of people, suddenly had this whole narrative of, well, if we, because we had to stop moving. We had to stop moving between households, between borders, and suddenly there were also differences in who was allowed to move. So we saw in South Africa, when the borders all closed, it was only land borders that closed. It was where working class people moving between borders for work were no longer able to move. But you could still fly into airports. So for a long time, that really showed a kind of very specific way in which this idea of health security. No one ever spoke about the first 4 cases of COVID in South Africa actually being imported, if we want to use the global health security language, from 4 white, wealthy South Africans who'd been on holiday in Switzerland skiing. And they were actually the sort of patient zero. If that had been a different individual, we would never have left that conversation and story alone, right? But because it was sort of hidden out of the discussion. And so we have to figure out how we bring these things together. What does this mean when we think about migration for development, which many of us would debate is a very dangerous argument around sort of placing the pressure on individuals to be entirely responsible for their own social economic development by moving for work. But it is a part of the world we live in, and how do we bring all of these issues together? Can we go to the next slide? So we know that over time, and obviously colleagues have spoken and will continue speaking to this, when we think about the decolonization of states and the kind of very strange contradictory moments where certain parts of colonial regimes were retained. And when we look at, for example, health acts or acts that were designed around sanitation, acts that were designed around sort of preventing movement between, colonized spaces or where we leave the indigenous peoples. And actually we see those acts are still in a maybe different version with a slightly different label, but still persist in many spaces. In South Africa, our latest iteration of the Immigration Act is the Alien Control Act from the 1970s, but it's been modified a bit. But actually we've seen at the, from 94 onwards, where borders should have been opening, actually this language of the other and the alien was retained. We see that in the ways in which some of the sort of sanitation acts of 1940 in South Africa actually are what is informing sort of environmental health legislation today. And how and why has that happened? We see the blurring then with sort of this idea of moving sort of into the language of the geopolitical, and many refer to the geoepidemiological, thinking about security and borders, and really focusing here on kind of health and homeland, and very much this idea of where lines are drawn. And then within that, we need to think about the movement of people. I imagine there's very few people here who were born in Colchester. Maybe there are some of you. There were, I imagine that many of us have lived, worked, studied in different locations, whether through choice or not. But yet we still shy away from what this language of migrant means. And we still often refer to that migrant other, that migrant different. So we're not talking about the exploitation of the movement of people. We're going to have a global health systems conference in Dubai, is it, next year? There was, whatever it was, the other year was in Qatar. We know the number of migrant bodies that died building World Cup stadiums, yet the global health peoples are establishing conferences in these spaces. And we need to better think of those sort of dilemmas that we are faced in many ways. Just to the next slide, please. So, I know I've got to draw to a close, but what I wanted to do was, many of you will have seen the letters that were initially leaked and then formally shared in South Africa when overnight programs were terminated. And the majority of those letters actually ended with, thank you for partnering with USAID and God bless America. And this was the message that people literally woke up to on a Monday morning, being told that every single colleague in their program had to be, from that day on, no more spending. So we've seen, obviously, across the country, a huge number of people directly affected by service provision being cut. But we also have to think about the number of community health workers, the number of staff working in public hospitals, the number of research staff and the building of research capacity that is affected. Yes, we need to think about why is it that a state like South Africa, technically a upper middle income country, should be able to afford these things. And it does have budget, but it chooses to do different things. So yes, there is a moment for rethinking what aid is, but when aid does exist, we have to think about how we exit. And we know that there is no opportunity here for catching back up. And we are seeing the ramifications within a week immediately. Clinics providing treatment to mobile sex workers, for example, overnight. Your 6-month check-ins where you come, you get your drugs, you're brilliant, you know, you're doing brilliant on treatment or on your prep, just go, somehow get into the public sector. But we know it doesn't work. But the most worrying thing, if you could just press the next click, I think, is if you read this, this could probably have been written today. The kind of geopolitics of disease prevention continues in the realm of health aid and development. For example, assistance with HIV/AIDS treatment will be given there in the form of aid, but not here in the form of state-funded treatment of refugees. And if you could just do one more click. This was 2006. Alison Bashford, I mean, it's a great book I really enjoy, that's looking at coloniality, borders and health. But it really is the premise that was written in 2006, so probably written in 2004, you know how publishing goes, and just the relevance of that today, and that we've actually gone backwards, but within a new geopolitical moment. So I don't know if that was what Anuj wanted me to talk about. But...
Thank you so much. It's really super interesting. We're now going to turn to our final presenter, Mikhail. The floor is yours.
Thank you very much. It's a real pleasure to be here and to share some reflections and be part of this panel. And I was wondering on what I could talk in this panel because the topic is so huge. And I decided to share some reflections on kind of doing decolonizing global health in practical terms through, and we mentioned this before, dialogue in the first panel and human rights in a critical perspective. And I think there is a lot what one can be critical with human rights. At the same time, I think they offer a lot to us. And now I hope this works because I have a lot of clicks. I used to make the presentation with a lot of clicks. So please go ahead, the next click. And you have seen my introduction slide already. Can you do the next, please? I will start with my background with the situation where I got the first time exposed to, oh no, it's everything together. Okay, the first time exposed to these ideas of colonialism. When I came to Ecuador in 1992 as a medical student looking for the way of doing something like medical anthropological research in the Amazon, it was 1992. It was the year of 500 years of indigenous resistance against colonization. And it was deliberately saying it was 500 years of resistance, not because there were 200 years of independence of the Latin American states, but it was 500 years of indigenous resistance, saying that even with independence for us as indigenous, there was no change actually in the structures. And that was that impressed me very much. And then I found this cartoon in 1992, just when I arrived from Bonil, and it says, you can see, we come from far away, we want to talk with you about civilization, God, and the true man. And then the person says, yes, okay, what do you want to know? And I was really starting as a German medical student in Ecuador. That impressed me very much and shaped a little bit my way of understanding. And then I think for me, this is also part of what is decolonizing means. And when we talk about decolonizing global health, for me, it's very important to have a clear notion of what we talk about and what we think about. And for me, kind of the definition I work with is that we need critical reflection and constructive dialogue for really addressing the historically shaped power imbalances and structures of inequality in the field of global health. That's for me kind of the task. And I think that we really need, the next, please. The next one, please. We need really human rights in this or we can use human rights for this endeavor, but we have to think about what are human rights. And so I have now 4 kind of critical questions for me. First of all, what are we thinking about when we think about human rights? And for me, the first article of the Universal Declaration, all people are born free and equal in dignity and rights, is a very powerful sentence. And even though it's in its critical context, but it's very powerful and really happy that we have it. That there were some people in 1947 and 8 to gather to do this and to bring this through with all the political compromises that involve, but I'm happy that we have it. If we wouldn't have it, it would be a worse situation. So, and this is true when you think from a natural law perspective that all people are born equally. That's kind of, but it's not true because the reality is different. But we have these two dimensions. The next one. And the next click, please. Oh, I'm thinking that also has to advance here. No, oh, now we have all the four. Okay. And then what are the origins of human rights? I think the central origin is not the American Declaration of Independence and the French Declaration. It's really, for modern versions of human rights, is world history and the realization of many people in many countries and contexts that the power of states needs to be limited and that all individuals must be protected from the abuse of power by states or third parties. And we have to go back to the 20s to understand what this really means. In the 20s, there was a first international, there was a very important international legal contract, which was the treaty, the Minority Protection Treaty in Poland, defining that Poland must not do whatever they want with the minority people. And countries like Great Britain opposed to this kind of treaty because there was still the notion governments can do whatever they want with the people in their territory. They can deport, they can kill, they can abuse and whatsoever. There's nobody who can intervene. And the basic idea is that no, states have to follow the rules, individuals have to be protected. And that's a very powerful idea. And that's, I think, the basic idea of all this. And what is, no, please give the meaning of the right for global health. I think we have now with the General Comment 14 from the United Nations, we have defined that access to care without discrimination is important and the determinants of health are important. But at the end, it's kind of, for me, a rehumanization of health and a demedicalization of health. So that health is not only medical and medical care and treatment, technology and costs, but investment in the determinants of health. And with this, you are on the political realm. And when we talk about with Joe about migration and health, so migration politics are detrimental political determinants of health. And we really have to oppose to this and show as physicians and health research, stop these kind of politics that really not only put at risk, but that really kill people. And we see the relationship. And that's kind of the politicization of health. That's the core for me of the human right to health. And how can we do it? Well, we have, luckily, we have a couple of laws, legal and political instruments that are still not sufficient, that are still far from being perfect, but the history of human rights, of modern human rights, is only 80 years. And now we're in a crisis, okay, but it's a very short history and there's still a lot to do. And I think we have to look in this way and be happy with all the instruments that we have, but we also need an active civil society. Human rights don't work only when we rely on states or the UN. And we also need, I like this term of human rights consciousness, that people know about their rights. And working with indigenous people in the Amazon, they claim their rights, saying we are humans, we have rights, the state has to respect, the oil companies have to respect, and they can use this claim in human rights language with civil society organizations to put pressure on the state, on oil companies, for example. But also, and this especially for academics, we need critical research, critical medical anthropology, critical medical history. So medical history usually was kind of telling the story of the success of medicine, of male physicians actually. And I think that's a very old-fashioned way of doing medical history. We can do a critical medical and health history showing the historically how health inequalities were shamed through political decisions and this kind of things and institutions. And also critical medical anthropology is very important to understand all the different determinants of health at a local perspective and this is endemics and so on. There are kind of very interesting methodological approaches to make visible all these different determinants. And now how to go into practice, and that's my last slide. And I'm very grateful to a team I worked with in the last year with Anna Manuel Byrne and Daisy Lima Ventura and others from Canada, Brazil, Peru, and Germany on a project where we looked how marginalized communities experience the COVID-19 pandemics and if they, from their experience of marginalization, developed kind of political engagement. And And there we applied we tried to apply it to work really in a decolonial way among 5 countries, which was pretty interesting. And what does it mean in practice? So we did this, and I think one has to do collaborative research on the determinants of health. So this kind of critical research, looking on local agency and avenues for change together. And then we need theoretical concepts and approaches, epistemological approaches from authors from the global south, not only read the authors from Gießen Nobel Research, from Essex and from Harvard and from whatsoever, not only have the northern voices, but really voices from the global south. And I'm very much impressed by the South American people. And then do kind of non-extractivist research, which means that we don't go, and I mentioned this morning to Paul in the conversation, I learned from the indigenous people, they told me, we don't want you here if you do this kind of mosquito type research. Why mosquito type research? Mosquitoes vienen, pican y se van. They come, they pick, and then they go. That's a typical Western researcher in the Amazon, like the mosquitoes, and they really don't want to have me like, and they met me really with kind of reluctance. I really had to convince people a couple of months really to be there, to stay there, but they get to know me so that I really could engage with them. And for this reason, I like this notion of slow research very much. We need time to create social relationships. We need time to be there. And this kind of fast extractivist, even though it's called qualitative research, we have this rapid qualitative assessment research, which for me is kind of a fake qualitative research, because for qualitative research, for really being good research, meaningful research, you need time and engage with the people. So slow research is very important. And then we worked in this project in a multilinguistic team. So we had 5 languages in the team, and not all people spoke English. And usually when you don't speak English in global health, you are out. You have no chance to communicate, to understand, to say something. And then we worked in these 5 languages with only one person knowing all the 5 languages. So in our online meetings, we were translating every time, which is taking a lot of time. And then with the time difference between Brazil and Germany, for example, and Peru. So in the evening, for 2 hours or more, and translating everything in so that we understand. But that was also very interesting to see, how do I translate? What do you understand by this? Oh, I understand. So opening up going out of this colonial English world to speak different languages and be open. And also for the English people speaking people, they don't understand suddenly everything. They cannot, like before, always kind of dominate the conversation, because is their tongue. And when you have English as a second tongue, or the third or the fourth tongue, you are not in the same capacity to communicate. And that excludes. And so we tried this, and that was really interesting. And then the Brazilian people really asked for dialogue, and quoting Paulo Freire was love, humility, faith, hope, and critical thinking. So categories we usually don't talk about in Germany. When we talk about research, we don't talk in Germany about love and humility, faith, hope, critical thinking a little bit, and we have critical theory, but that you really think about human relationship in research, to be this humility, this faith in people, in your colleagues, and hope for better choice. So, and now we try together with Milena, a student, and she's co-organizing with me. She's sitting there, a conference in Germany on decolonizing global child health, and Anush will be with us and helps us also. So we try to apply this now in organizing a conference in a different way, where we don't have only one person speaking, the others listening, but more panels, more young people, more different voices, more conversations, a couple of things we try to put in practice, because we see that many people talk about decolonizing global health, and then there's kind of some symbolic action, but in the essence, it goes like it was before. And I think we have to change this. Thank you.
Thank you so much. I think we have 3 really different layers of presentations, which hopefully has really good food for thought. Let's take a few questions, but also can I remind the people who are joining us online that they too can pose questions. If they can write them, then they can be read out for answer. We only have a few minutes though. So can we take a first rounds of questions now? Does anyone have any questions or comments?
Thank you for that wonderful presentation. I think Michael, yeah, you mentioned about doing collaborative research and ensuring that different languages involved and all these different things. But in a situation like now, I don't know whether you are aware, in the UK, higher education sector itself is struggling so much. Research fundings are being cut, and very limited. So in this situation of crisis, how do you ensure that we still work collaboratively? We still make sure we do work, ensuring that there is some sort of equity and equalities, all these things. And I like from South Africa, when you talk about this identity crisis, and I felt kind of, linked, like I could feel that because I originally come from Nepal and studied in different parts of the world. Now I, work, I work, teach here, and I always feel that crisis, like who am I basically, and it's very hard, like when you are struggling with all the language and identity crisis yourself, and going and doing the work in public health and global health, and now going through all this scenario, like what am I supposed to do? Where is my role and place? And it's really difficult, despite all the education. So thanks for that reflection. Any other questions?
I have a map voice on this project.
We need you for the online.
I don't think it's a question per se, but it's a comment, I think, on the last presentation. Thank you for all the previous presentations as well, but taking into account the importance of that kind of, when you're doing research, that grassroots kind of approach in terms of involving the people. I think the term that you used was in terms of the mosquito research. We hate that. I mean, I also hate that. The fact that when you turn that back as well into a lot of the UN projects that happens in a lot of the global South countries, you feel as if there's people that's coming in and not actually listening to you, or just telling you what to do and not actually contextualizing that to culture, to many different things. So I just wanted to comment on that, the importance of that, also the importance of language, of speaking a language that the people that is affected understands. Because a lot of the things is when you walk in and you are a different ethnicity, or it becomes difficult to actually interact and to get anything out of that. But to take the time to actually do that, I just really wanted to reflect and comment on the importance of that, and also to just say thank you for that.
Final comments, questions from the floor? Anyone? No? Now we'll come back to the panel. Sorry.
I mean, if someone else would like to speak. I've already spoken. Yeah, thank you all very much for great presentations. So just a question for Jude. You mentioned Gaza, and so what's happening in Gaza is the kind of denial of the right to life, the denial of the right to medical care, etc., which you outlined. And I was wondering whether this is a new phase. This represents, maybe an ongoing phase in colonialism. In that, I was thinking one of the parallels is the UN Declaration was drafted in 1948 or released in 1948. That was just after World War II, and in many ways it was a response to World War II. But the Allied powers exempted themselves, or they were exempted from the atrocities that they had committed. I think 37,000 people were killed in one night in Hamburg in 1943. 420,000 Germans were killed, civilians. And in, of course, Japan, it was 110,000 or something. But I don't think there's been any accountability for that. And I'm wondering if this is a sort of an illustration of the kind of exemptions that exist in the field.
Thank you. And remember that the conversations can continue over lunchtime. So I'm going to turn back to each of the panelists and ask them to answer the questions that reflect to them, but also to comment if they have any comments on the other presentations. So just a few final words.
Thank you, Colin. I'm not sure if I read all my notes and I was talking about that, but one of the things I had written down was really about the turning away of Western governments and faces from the situation, and particularly in the last few weeks, as the world has become much more concerned about economy and trade. Obviously, huge issues, but absolutely, I think it's deeply worrying, and I like how you sort of draw that parallel back to 1948, and yeah, I mean it's on us really to keep on civil society activists to keep the attention there, as well as what is otherwise really a predominant concern at the moment with kind of capitalism and international trade.
Yeah, thank you so much, everyone. And to my colleagues, lots of things that are just sort of reinforcing this idea of kind of identity crises more sort of broadly, I think, and really going back to sort of the ambitions of public health and the ambitions of global health, interrogating whether they were right or wrong to start with, but really saying, what does that mean for today? And what should we be learning in our own praxis? What should we be doing when we're learning with students or learning with others? What should we be looking for? We know what isn't working. Our ambitions might be good, but it's not working. And I'm not sure what we should be doing differently, because we're all stuck into this sort of, this is what we're doing, and the ambitions of public health often are for good. And so how do we sort of engage with this like impossible political space? Because we know without political will, things won't change, and we can't deny that. And who else do we need to be working with outside of a global health sphere to be making those changes? Who needs to come together into truly interdisciplinary spaces, and into truly cross-sectoral government, NGOs, civil society, international organizations? I don't agree with the moment for the refresh button that people have been trying to turn the USAID withdrawal into this positive. Same with COVID, or it was big reset. We haven't learned from COVID at all. The successes that we did have in South Africa, which were long coming, haven't in any way been reflected in future health programs in any way. So it's what do we need to do differently to manage to re-identify?
Thank you. Also from my side, thank you very much for this panel. And I had one question to respond: how to do this kind of collaborative decolonial research and collaboration in times of this economic crisis. Well, at the end, even when the economy is running well and when there's money, people don't do it. So it does not depend on money. It depends on the decision people take to do it in this or another way, I think. And we all are different in our positions and situations, and some people have the possibility to take decisions, to open spaces, to change. Others don't have. Students, for example, they can give good ideas and challenge and ask, but the professors at the end have to take the decision. So it's good to doing this together and to listen. And then as people who have the power of taking decisions and of funding and of writing applications whatsoever, that they still keep committed to this kind of way of doing it and investing the time, investing the money that you have. But I think it does not depend only of money. At the end, everything, also human rights and the right to health and this kind of things, it's not only a question of the available money, but it's really first a question of personal choice and of political choice. And that would be for me the most important products.
So I think we now do have one question online. So if we can just read that quickly in the spirit of hearing from people.
Okay, so we have a question from, okay, there's no name there. It says, in current era, all the aid, such as UK aid and USAID, is cut off from many developing countries. So how do we better tackle inequalities?
Thank you. And we're just going to take a final comment from here.
The next panel will have all the answers. Hello. Hello. I am a PhD student here, and it's actually not a question, it's a reflection on Judith. I commend you, actually, I applaud you for your courage, dedication, and devotion for illuminating and shedding a light on the abhorrent situation in the Gaza Strip. I just want to read for a minute an exchange, WhatsApp exchange with my former supervisor when I did my MA in Human Rights at the University of London. I sent him a text. There is a conference tomorrow at 6, reimagining global health and decolonization of human rights. Great. From today dawn, I meant yesterday, until now, 55 Palestinians were killed in Gaza. The situation in Gaza is very painful. The health challenges are immense to grapple with. Nearly all hospitals are being destroyed, damaged, and partially operational. Today, Gaza has the highest number of child amputees per capita anywhere in the entire world. They face life-changing injuries and need continuing rehabilitation and reintegration into society. And I want to comment on what Professor Colin Sampson has referred to. Maybe over 60,000 Palestinians were killed, 18,000 children are now orphaned, 15,000 children are dead, countless number of them are buried under the rubble and ruins of their homes, and surgical procedures are being undertaken without anesthesia. And the starvation is being used by Israel as a weapon of war to subdue Palestinian people into submission. And malnutrition is very rampant. Infectious diseases are on the rise, which were unthinkable until 2 years ago, until the 7th of October. And Israel is also attacking Syria and Lebanon. So it's a reflection and a question. How do you convince people, especially in the Middle East and around the world, millions who are protesting pro-Palestinians here in London and elsewhere, about the vitality, truthfulness, and the validity, effectiveness of human rights and global health?
Thank you so much. I think these are important questions to guide us over lunch and in the afternoon session. Unless anyone has anything pressing to add to this right now, I think maybe the way to close is just to reflect a little bit on our the last comments and perhaps Colin's comment about exceptions and the exceptionality of human rights. The extent to which there are exceptions which are allowed to exist at the normative level or at the level of implementation, that's the barometer of our challenge. And that's the weakness of human rights. So in a way, our task is really to ensure, to work, to fight, to remove the exceptionality, which is really embedded both at the normative level, but clearly also at the implementation level. So without that, I'm going to thank our participants and thank the audience for the important questions, and let's continue the discussion over lunch and beyond. Is there any announcements that need to be made?
We have 45 minutes or maybe 43 now, and we'll be coming back for the final panel. And themes that have been touched upon will be continued in that.
Thank you.
And lunch is here. Huh?
Yeah, so it's this one spot, it's another spot. It's like remind me to never focus on the big. This is not for big. Yeah, exactly. It's like that's what's great. So this we got to be small, right? Yeah. It's just maybe it's like just yeah, but you know, it's like, and it's I'll manage the next section for you. Yeah, yeah. And that's it.
The other thing that
I did not, I just died by the time I read this. I'm planning to papers and arrows with it, but that. This is cute, this is all of us. And also the setup is typing things so. Where did I, like, so I studied. Followed the news when I came to Essex. Yes. Is it not called the main station? Is it? Yes, it is. Yes. Got off. Yes. Yes, it is. These are the other thing I'm saying. The main station, because there's other stations in Colchester. That is the main station. So if you go to London, yeah. I didn't decide, so I put up the part. Second. Yeah, no, exactly, yes. Question. Question for voice mates. Right, right. When do they meet? So they just.
Okay, welcome back. Can we get everyone seated, prepped up for the next session? Yes, good. Do you want to just go and call them? They're all outside enjoying the sunshine. Good idea. Also, just want to make an announcement that we will be having this session, and after that, we have the SU bar booked for drinks. So all of you are welcome to join there. And we are hatching plans for going after that to Wivenhoe, to the Rose and Crown Pub. So just some plans if you want to change your return tickets to wherever you're going. Others have already come prepared. Do we have people on screen? Can they hear us? And would it be possible for people to just come closer, probably towards this end, so that the questions that are being asked for our online audience, they can see your faces as well. I know this is a very weird camera setting in this room. Okay, so welcome back everyone after those really simulating 2 sessions this morning. we are now entering into getting into a discussion and a fireside chat with progressive alliances, third sector charities, international development organizations. We have a stellar panel, and I'm really excited about this, this session, because we're going to address all the issues that have been raised in the morning session. But on a more serious note, we did think that we are aware of the challenges and the crises that we are seeing today, and what its real impacts on human lives are on the work and advocacy and activism that we do. We did want to have space for this discussion, which is really about how do we build from this ground zero. We have great, we have a very wide representation of the sectors and the issues that we will be speaking to in light of the larger conversations about rights, human rights, global health and social justice. I will read out and introduce all the speakers and ask them to join me here. At least 4 of them are joining in person, and we have 3 others who will be joining us online. But before that, I also wanted to just very quickly place this thought out there and address the discomfort we have about discussing decolonization sitting in global north, or who speaks about decolonization. And my own view, and I would welcome that discussion to happen in this group, is that decolonization is not simply about the global north versus global south. The process of colonization created marginalities and marginal subjectivities and colonies in global north. What we're also seeing as a counter trend is many countries in sort of post-colonial context colonizing other parts and populations as we speak. Second aspect I feel that is really important to reflect on is both as being in a location which has benefited from those colonial processes, as well as in institutions, regardless of whether we're white or people of color. I think it becomes our business to talk about decolonization. So I just wanted to address that discomfort, and I feel that we need to talk about this at every point, every site, and whoever we are, from different positionalities and subjectivities. But I do wish to place that and, of course, invite reflections on it through the course of the panel. But before that, I want to introduce our speakers in no particular order. Just in what I'm looking at here, one of the speakers for this panel is Professor Dame Parveen June Kumar, who is with who will be representing UK Health Alliance for Climate Change. I'm not going to introduce the work of the organizations that they're representing, because that's what through the panel we'll do. But just very, very briefly talk about the speakers. They're Emerita Professor of Medicine and Education at the Barts and the London School of Medicine and Dentistry at Queen Mary University of London, Ambassador to the Health Alliance for Climate Change, co-chair on the BMJ Commission on the Future of the NHS Patient Care, which is an excellent volume reminding us of the founding principles of the NHS, if you haven't already looked at. And Parveen worked in the NHS for over 40 years as a physician and gastroenterologist, and has been a strong advocate for ethical practice and health equity. And in recognition of her contributions to medicine education, she was appointed Dame Commander of the Order of the British Empire in 2017. Our next speaker is, and Parveen, please join me here. And we also have on the panel Martin Drury, the CEO of Health Poverty Action, a progressive international NGO, also rooted in the global people's health movement. Martin has played key roles in several large coalition campaigns and was co-founder of the Trade Justice Movement, one of the elected team leading Make Poverty History, graduating in peace studies, and he began as a grassroots community development worker. we have Anna Paris who's the executive director of the MEDACT, and I'm really pleased to have her here. I'll let her explain what MEDACT does, but Anna has also served as executive director for UAEM in Europe, where she mobilized local groups to advocate for equitable access to affordable medicines, for promoting intellectual property reform at academic institutions across the region, and has worked with municipal governments at C40 cities, supporting cities in decolonizing their public transit fleets and implementing infrastructure for sustainable urban transformation. Anna, really delighted to have you. Joining us virtually are three friends and comrades. Okay, the first I'm seeing first is Dr. Andreas Wolf from Medico International. Andreas is a physician and joined in 1998 Medico International in Frankfurt in Germany as a global health policy advisor and project and network coordinator. He's also a board member of the Geneva Global Health Hub, G2H2, and served as its president from 2018 to 20. Also served on the Health Action International Europe Association board from 2004 to 2010 and later. We have Jonathan Glennie. Has Jonathan joined us? Yes. Great. Who's representing Global Cooperation Institute and is a globally recognized expert and researcher on development cooperation in a new era, including development finance, the role of the private sector, INGOs, and civil society and human rights. Again, very impressive bio, and I'm just going to say he's well-known analyst and commentator online, and helped set up the Guardian's global development website, and has been a regular columnist, author of The Future of Aid, Global Public Investment, Aid, Growth and Poverty with Andy Summer, and The Trouble with Aid. So really bringing in the perspective on aid and colonialism. And final speaker, has Ravi joined us?
Yes.
Okay, great. So Ravi Aram is joining and representing Kampala Initiative. He's joining from Kenya, a health systems evaluator and specialist with a focus on community health, equity, gender, and social accountability, as well as primary health care. Of course, Ravi represents several networks today, People's Health Movement, COPASA, which is in a community of practitioners working on accountability for social health. I think that's what the broad acronym is. I don't, but I'm sure Ravi will correct me here. And of course, the Kampala Initiative. So that's the panel, a lot of experience on the ground, but also advocacy, activism, and strategies. And I wish to start this fireside chat. We don't have a fire, but the fire is in our bellies and in what we are going to say. So in this conversation, I'm going to just start with asking all speakers to introduce what their organization represents. So what sort of axis and aspect of global health, human rights are they working on? And also one big threat that they see today for their ongoing work. So should we start with Anna?
Great. Hi, everyone. Thanks for having me here. As Anush mentions, I'm the director of MEDACT. I will clarify the new executive director for MEDACT. It's actually my 12th day in this role. So I'm going to do my best job to represent the organization, but really I'm speaking to the wonderful work that my colleagues have been leading on in the past few years, and speak a little bit around how we do the different initiatives across the UK and a little bit internationally too. So MEDACT, some of you may have heard of us before, but we are a UK-based health justice charity, and we focus in tackling the roots of health inequity. And we do this by mobilizing the health community, healthcare workers across the UK. We tackle the roots of health inequity as we recognize that when we talk about health, we're not just talking about health in an individual body, we're not just talking about individual disease or condition, but we're actually talking about things that is impacted by the social, the political, economic, physical conditions that surround us, and that these all do interact to then create and sort of spread wide health inequities, both in local communities and beyond as well. And as part of that, to address these roots of health inequity, we work with healthcare workers and mobilize the healthcare workforce, as we recognize that there is sort of a unique positionality and responsibility of healthcare workers, not in like speaking for different communities, but actually working in solidarity with different communities, and lending voices, expertise as the healthcare force with these communities in tackling all these different subjects that deal with roots of health inequity. And just to give you a few examples, because I recognize it's a little bit theoretical that I've given you right now, but for example, we do a lot of work most recently in housing, so looking at the economic justice elements and how that links to health, recognizing that where we live can have a very big impact on not only sort of our current health systems, but also looking at at an individual level, creating new health problems or exacerbating existing health problems, and working with communities to ensure that they actually have a safe place to live that does not cause or exacerbate these conditions. Also looking at to climate as well and how that links to housing and health, and looking at sort of ending fuel poverty, pushing for retrofitting at homes. Our big case, I was saying, if I don't do a very good job at describing MedAct, I have some very good pamphlets. The case to warm our homes and not warm our planet. And also working in areas around securitization of health, so looking at charging within the NHS, and then also looking at the intersections of human rights and healthcare, and looking at as well sort of the interlinkages when we're speaking about what is happening in Palestine right now, which I know has been mentioned quite a lot already, and also nuclear weapons. So you can see we do quite a bit of everything, as we do recognize that there are a lot of things that feed into these roots of health inequity, and that the healthcare community does have a responsibility to speak on this and work with communities to address these as well. And then to lead on to sort of the second point of the question around the thing that is the biggest threat, I think for us, we as an organization, we're membership led, so our members are the healthcare community. And when I talk about the healthcare community, I'm not just talking about doctors, I'm talking about anyone that's involved in making the world a healthier place. So public health researchers, nurse, mental health assistants, anyone that is involved within that paradigm. They are the members of our organization, and we organize locally in different groups. We're across the UK, but we also organize nationally. But that what we're seeing sort of a very big threat is sort of this rise when it comes to all these very bad things that we're talking about and have been talking about sort of nationalism, particularly in the UK, this anti-immigration sentiment, and sort of feeding into this fragmentation. And that sort of is making it very difficult to engage in conversations, very difficult to mobilize and organize, and also campaign. And I'll speak to this a little bit later, but in recognition of this risk of fragmentation and the need to sort of put things in place to resist this and to ensure that we are working together, that we are not just working separately or not working at all on this, that we have actually changed our approach at MedAct within the past few years as to how we mobilize and tackle these issues that we're seeing. But I will, give that as a little bit of a teaser to speak about later, and probably pass the microphone on. Great.
Thanks, Hannah. Okay, so I'm Martin Drury, Health Poverty Action. I'm going to try and talk really fast and short about the organisation itself, because I want to talk more about the struggle that we're part of. So we're an international NGO, which I immediately feel I need to therefore clarify and apologise for. We need to recognise that we grew out of the aid sector. I'm going to be very critical about aid, but we grew out of that. But important to note that all our leadership today is in the programme areas. We don't have any offices in the UK anymore. We're trying to internationalise the board, and my successor hopefully will be, somebody from Africa or somewhere different. And that's one thing. The second thing is that we see health as a profoundly political struggle. So our job is to act in solidarity. So that's practical solidarity, trying to access international resources for the people in the local communities and those marginalized communities that are engaged in a very practical struggle for health every day, and to act in political solidarity to address the political determinants of the health injustice. So we have about 300 staff globally, most from the communities they work in and located physically in those marginalized communities. A call recently, one of the staff just on a Zoom call said, sorry, I'm going to have to go and break off and join you again in a few minutes because there are gunshots being fired outside my house and I need to go and hide. That's in Myanmar. So it's easy to talk about solidarity, but it's important to remember the reality of it, that, you know, I work in my bedroom in Sevenoaks as a colleague of people in very different circumstances. So the challenge that I want to highlight is, well, one, the immediate one is that we're funded almost entirely from aid budgets, directly or indirectly. 98% of the funding comes from that. And almost all of that is disappearing. The 50% cut in the US is actually, whilst USAID was closed, the funding is reduced by about 50%. The UK, despite getting not nearly as much flack for it, has cut almost as much, by 40%. France, similar, Netherlands, Switzerland, it's happening all over the world. A lot of what's left will go to things like the World Bank and established international things that governments contribute to. So what's left for real development work could be almost disappear. So the sector, the international development sector, for all that's good about it and for all that's awful about it, could potentially disappear over the next couple of years. It will certainly halve in size, probably at best, and probably worse than that. Whether Help of the Action will continue as an organization, the struggle will, the people will. Beyond that, I don't know. Time will tell. But here's what I want to frame the issue. Two quick facts to put it into context. We met recently, well, one of our colleagues met recently with, I won't name the person because it was a private chat, but this is a senior Labour politician involved with the FCDO, and said that the most popular thing the Labour government has done since coming to power was cutting the aid budget. Other thing, recent poll of the poorer people in the UK, I can't remember what the threshold was, but those with lower incomes are twice as likely to vote for reform on current polls as they are to vote for Labour. Now, why? I think those two things are connected. And why? So this is the issue I want to point to. And it's about the aid, the concept of aid. The funding, the finance matters. But without that, people are dying by hundreds of thousands, millions probably, as a result of these cuts. But why was it being cut? Why was it popular to do it? And I think that's around the aid narrative. If you look at how power maintains its position of power, almost always it involves something about divide and rule. The masses, if they're united, are more powerful. The power of the elite can only be sustained if they're not united. Now, what the message of aid does, as Anush said, if you look at what happened in colonialism, it increased inequality throughout the whole world. People living on poor council estates in Glasgow are victims of colonialism. People living in absolute poverty in Ethiopia are victims of colonialism. They ought to be allies. They ought to be acting in solidarity. They ought to perceive themselves as being on the same side of the struggle. What the aid narrative tells you is that it tells the people of Glasgow that they're the rich world and they are the generous benefactors of the poor world. Firstly, that's a complete lie about the real relationship between the countries. But secondly, ultimately, that's only going to lead to one place, which is what we've seen now, the current political context. It leads to hatred against the other. It's not the only thing that causes a rise to the far right. Blaming refugees and migrants is all part of the same thing. But the aid narrative, not the finance, the narrative is one of the fundamental parts of the problem. Now, we've finally got an opportunity because for years and years, the development sector ought to have been getting a different message across. It's not about poverty, it's actually about inequality, I think. It's about, and particularly inequality of power. Poverty isn't ultimately lack of wealth, it's lack of power, and it's how that's shared. And so the aim of the sector shouldn't be helping the poor. It's about tackling inequality. That message unites. It unites the poor around the world. It changes the political context completely. But the charities, the sector could never get out of perpetuating this aid narrative. And I think one of the issues is we haven't got an alternative message. I think now, finally, they recognize that we won't be able to win the current political argument by repeating the argument for aid. We need to say something new. So I think the challenge for the likes of us in this type of conversation is to identify in a simple way, and that's where it becomes a bit harder, what that can be. Now, in terms of generating the finance, Jonathan Glennie is going to speak later and he'll suggest one. And in terms of the overall narrative, I think it's around inequality and more than anything else, because that focuses on the rich as well as the poor. But anyway, I've taken too much, sorry.
Just reading on the slides. Lovely. Thank you very much indeed. So I am the ambassador for the UK Health Alliance for Climate Change, which started over 10 years ago. I was very small and we've grown and grown and grown. And with that, the power of actually getting anything done is so much better. So this is really a slide of all the organizations who are representing us really, are belonging in this association. And Anna, you're in there. And the ones that I put on the right are the ones that have just joined this year. So as you can see, there's a momentum for continuing to increase so that we do have a bigger reach when we talk to politicians and people elsewhere. Thank you. We also, obviously partnerships is a great thing and we can all join together, and the various alliances here. So the alliances and coalitions are on the left. And as you can see, it's a member of a group of coalitions alliances which contribute and have steering groups, and we support campaigns. The second one is the Health Organizations Coordination Group, and they have a regular meeting every month. And we tend to run them. We support each other, collaborate, and see what we can do. And then the last one is the Global Climate Health Alliance, GCHIER, and that's an alliance of more than 150 health NGOs around the world, professional organizations, environmental alliances, and so on. And our director, Elaine, no, can you stay where you were? And our director, Elaine Mulcahy, sits on the board of GCHA and also is a member of the engagement committee. And really, they meet together, there may be huddles, they can talk to each other, they can liaise. And it's in fact a very powerful international group. Thank you. So the priorities when the new government was coming in, we thought these were the 5 main priorities that we thought the government ought to look at. Firstly, end fossil fuel dependency, which is sad what's happening at the moment. Ensure a healthy environment, obviously better for health. Transform the food system. A lot of work to be done there. Meet international commitments, which, as you know, countries tend not to do. And then transform the health and care services. It's very much a health-orientated organization. Thank you, Bill. Oh, somebody's doing it for you. Okay, so I just thought I'd give you a flavor of what we've been doing since October. And so with the COP29, we sent a letter to Ed Miliband signed by 27 members of the group, calling for health at the forefront of COP29 discussions. You remember, in fact, both the COPs really haven't been, health hasn't been a major part of it. And I think the Glasgow COP was the first one, the climate change COP was the first one that we had our own health area.
We sent a joint letter with the GCHIER and other health organizations calling for ambitious climate action to protect health, again at COP29. And we also had a open editorial on BMJ and Lancet on COP29 and the move to move faster. We seem to be stalling at where we're going. COP16, which is the other COP, as you know, the diversity one, biodiversity one, we sent a letter to the Minister for Nature ahead of COP16 calling for action. And we did receive a response from the Minister reaffirming UK's commitment to deliver its commitments. That's very important, in fact. And then lastly, on the energy system, we had the response to the UK government consultation on scope 3 emissions from oil and gas, and also a letter to the Scottish government calling for reinstatement of wood burning ban. Thank you. So another one, please. Thank you. So the NHS, clearly a lot to be done. As Anna was saying earlier on, I co-chair the for the future of the NHS. So we wanted to know about the response to the, we sent a response to the 10-year plan that the Labour government has put forward. We also have a joint response to the NHS plan with CSE and the FSH. We've had discussions with and submissions of case studies with advisory groups, and also sent a letter to the Health and Social Care Committee calling for an inquiry into health systems preparedness, which in fact we're still bad at. We were talking earlier about Africa not being ready, but we're not either. Travel and transport, the NHS takes up 10% of the carbon footprint. So obviously we're doing quite a lot in their response to the active travel, the social justice inquiry, join the low traffic future alliance call for low traffic vision, and also response to consultation on the phase of petrol and diesel vehicles from 2030 onwards. And then food systems, a letter to the Mayor of London calling for leadership on plant-based diets. We received a response from the Mayor outlining his commitments to promoting healthier plant-based food. And also we were signatory to a letter calling for the government to cease supporting meat-producing campaign and try and go on to, thank you, onto plants. And this is just to show that there are various areas that it could be so easily done, which would reduce carbon emissions and help climate change. Next one, please. And that's just to say that we have an end of year report if you wanted to look at it. So we're doing quite a lot. I was going to show you a letter from the Prime Minister, but we decided not to. But really saying we're behind you, we'll support you, and we'll do all we can. But that's words. So I know you asked about current challenges. God, where do you start? But I'll give you three. And I think, Martin, you mentioned one already. So first of all, is obviously the political instability. We're getting a very polarized debate now, lobbying away from individuals and organizations against climate policies, which is tragic. We may be going backwards. The second challenge is deprioritizing of climate policies, particularly after the speech 2 days ago. But many big oil companies are now announcing and scaling back on their renewables. We thought we were getting there, but really Trump has really put us back again. But I think the USA has obviously lost the leadership. And I think this is where the UK can take up that slack and take up the leadership. And I think we really must do something that the UK stands up and starts to make sure we do revert on the policies that they've been putting into action at the moment. And then lastly, no surprise, is finance, particularly with the US pulling US aid, but also generally it's always a challenge, isn't it? But both climate and biodiversity COPs agreed on the loss and damage biodiversity restoration financing. But that's slow, and really climate change is going so fast. So I think for your challenges, I gave you three, but there are many, many more I could go on about. Thank you.
Thank you, Parveen. Now move on to guests speakers who are joining us online, and perhaps bring those who are farthest from us first. I'm trying to understand, and of course the different time zones. So possibly Ravi, you get that bid and over to you. Just introducing the work of the networks you're representing and the key challenges.
Yes, thanks, Sanuj. And just a quick check, you can hear me all right?
Yes.
Great. Thanks for those thumbs up. That's excellent. All right, just a bit about the Kampala initiative. It's a joint initiative by Medicus Mundi International and the People's Health Movement. We started in 2019. We put out our own declaration looking at the future. And our intent was to build on many of the existing analyses of the problems with development cooperation for health and see, or so-called aid, and see what could we do that actually translate more into practice and action. We held a series of webinars. We did produce some reports based on some experiences. Jonathan, who's going to speak fairly soon, introduced the idea of the Global Public Initiative, and we'll leave that to him. I don't want to steal his thunder because it's a good thunder. And I do hope to poke you a bit, so glad to see that smile. So some of the things we looked at were just, the move toward public-private partnerships, especially in Africa. We also looked at the Global Financing Facility, which nominally moved more funds toward maternal and child health or reproductive health, not so much sexuality, but actually just poking holes there and trying to understand what would it really mean if we wanted to address these issues and not just say, okay, a World Bank initiative again is going to be our savior. We also critically worked on the idea of localization, showing how that was in many ways just a front, just to keep the traditional aid model moving and put a veneer of trying to address some of what our critiques were about not being progressive and more so not truly decolonizing the whole premise of aid. And we also looked at the Netherlands, which in a previous government was actually moving funds in a different way. And that opened up the idea of a solidarity-based model. So we'll look at that. Looking toward this discussion, I don't want to spend too much time right now, but I will say where I see a challenge that we do need to address. It's in the dominant narrative, the way that all of us have our thinking being shaped. And in a space like this, we can easily talk about solidarity or resistance. We can talk about health is a political matter and not simply a technical or medical issue. But beyond us and our comrades, that is not well understood. And we have done a very poor job in the past, let's say 20, 25 years as funding for global health. However, we may criticize the form of that funding. We did not change the thinking of the world. I think Martin put it well that we have to accept that many people find it a popular move to cut foreign so-called assistance. And this is not simply right-wing. And I would say it's even popular, not in the sense of populism, but popular in that it's widespread. We need to address that. And I think there's an inbuilt flaw in that, something that we can look toward. But right now we have to accept that we are on the defensive. Let's also look at our own narrative in many ways. We talk about these issues, solidarity, power dynamics, and something I'll take from a former comrade, Ahmed, consider optimism as a form of political resistance. But I wonder if we're being too optimistic about the future and where we have a potential to make change, or just that things will eventually swing back in our direction and we can grasp it. We need to change how we are working ourselves, because we are at risk of becoming the reactionary movement. And we don't want the progressivism to become a reactionary movement. We've got to be more creative about what we need to do. So there's a lot of work that needs to happen in changing our own internal narrative as well, not just critiquing the dominant narrative of neoliberalism well, it's a pro-colonial enterprise. But when they talk about efficiency in government and putting our nation first, whichever one it is, they are able to motivate not just their voters, but their population. So let's acknowledge that and say that we have to do a better job at presenting our own ideas and shaping our ideas so that they are accepted, and not simply wait for these internal contradictions within the reactionary or the right-wing populist narrative. And I would say, in some ways, we have to recognize also that there is that internal contradiction. It's not truly a popular movement. It's an oligarchic control over a population, much of which is based on that narrative. They've captured people emotionally, whereas we continue with our political economic analysis of health. And one of them is very tough to read, ours. The other one is very easy to attach to, regardless of your political persuasion. And I do believe that what we're seeing now is a cry for change. And if we have failed, or if our former political allies have failed, it's really because we did not get the change that people deep down really want. And that's where I think that there is hope, but let's make sure that we are not just trying to revert back to, we need to support a global movement. Let's keep the principles of solidarity in mind, but let's also recognize that the ground has shifted beneath our feet and we are starting from a different point than where we were just a few years ago, or even months ago. I'll pause there, but looking forward to much more in our discussion today. Thanks so much to the center and UNRWA for bringing us together.
A reminder about our own narrative and the fragmentation within and the reactionary movement. Can I request Jonathan X to introduce his work and the Global Cooperation Institute?
Hello, hello everyone. Thank you very much for the invitation. Clearly, I'm going to learn a lot. I've already really enjoyed the first couple of presentations. I'm definitely not a global health expert. I'm surrounded in my work by global health experts, and I made a positive decision not to become one because I couldn't add anything. So I kind of come in with other kind of some kind of knowledge and experience, mostly around, I guess, the broader question of global cooperation and a post-aid world. I'm going to start by answering your question about what the kind of biggest threat is. I mean, you know, there's so many that one could list, but in the last couple of months, I guess, just in all the conversations and WhatsApp groups that we're all part of, I think there are two that I want to kind of raise. The first one is kind of grief, and I think it's okay to grieve a bit about the situation we're in. But there's quite a lot of work going on in the, let's call it the aid sector or the international cooperation sector, which is a bit grief heavy. And there were certainly things that I do think we need to celebrate about the last 10 years, the last 30 years, the last 80 years. I mean, going back all the way to, let's call it the beginning of the modern age of multilateralism. So I also think there's a bit of, sometimes there's a bit too quick kind of denigration of the past. There's a hell of a lot to celebrate about what we've achieved as a world in the last various periods of time, but it's definitely not the moment to try to get back what we had, because there was so much at fault, and people have already mentioned that, not just in the world of aid, but in the world of internationalism in general. And I won't kind of go through it. The first book I'm in an academic setting, so I'm going to talk about my books. The first book I wrote was called The Trouble with Aid. And it was, it was just a summary really of a critique of all the problems that there were with the aid way of working, especially in Africa. And from there was always this kind of tension or kind of confusion about how you have to move on from a world of aid, which is 20th century and full of its issues, and Martin's mentioned a few and Ravi's mentioned a few, and like we could all kind of summarize those, but at the same time somehow have continued large-scale international public finance to pay for the things we care about. And I'm just going to come on to that. So the first thing we need to kind of avoid is grief. And the second thing is defeatism. So like Ravi implied it as well, like Trump and his folks are doing so well in comms. Firstly, just to get elected. And now in the last couple of months to, I think, persuade us that they're winning. And that has led, I think, and I was just on a couple of calls this week that really led me to think that people feel quite defeated. I don't feel that at all. And I know that at the moment, there's a huge amount of cuts going on that will have real life consequences, not just in terms of jobs, but in terms, obviously, of people affected, especially in the world of health. And I know there's a huge amount of risk going forward. There's absolutely no certainty, and Ravi mentioned optimism, and we shouldn't be falsely optimistic. There's no certainty at all that this is going to get better. It could get a lot worse first. But I also think that the underlying trends that actually Trump is a backlash to are still as positive now as they were 5 months ago or 5 years ago. And those include, quite astonishingly for someone of my age, who's lived all their lives under there's no alternative to neoliberalism, we've emerged from neoliberalism. That's a big deal. Certainly in academic terms, we've emerged from neoliberalism, I think. It's certainly not dominant in academia. It may still be dominant in some aspects of policy making, but that's largely related to interests rather than I think kind of theory. So the return of the public, I think, is really a massive opportunity. And then there's so many other trends that I could talk about, but particularly I think the rise of the South. That's a huge trend that is still just as powerful now as it was before Trump got elected. And like I say, I think this is somewhat of a backlash to that. Voice and representativity in our institutions. So I'll just come on to kind of what I'm working on, which is this thing called global public investment. And I'm here representing Global Cooperation Institute, which is my little think tank sitting here in Bogota, Colombia, but really also the Global Public Investment Network, which I encourage you all to join. And it is an attempt to promote and provide a new way of thinking about international public investment and finance that is not constrained by an aid way of thinking, but is a we would argue 21st century way of thinking. But interestingly, is also quite an early 20th century or mid 20th century way of thinking. So the paper that I'm about to publish, that I'll try and share with you afterwards, is called The Birth of Global Public Investment. It's got a nice big kind of rising sun on the front to try and imply to people that there is indeed opportunity in this kind of moment of crisis. And the two things that it says, and I'll just end with this, the two things that it says are that there's two areas we need to lean into, and this is responding to some of the stuff that Martin was saying. Firstly, we need to lean into the mutual benefit, common benefit, mutual interest narrative. And the reason I say that is quite 20th century is that if you look back at the way that the Bretton Woods organizations were built, and we all know that they've not lived up to maybe their promise, but nevertheless, when you look at the speeches that came out of that conference, I was particularly struck by one by Henry Morgenthau, who was the US Treasury Secretary at the time, who said there's no tension between our national interest and the global interest. So clearly that was a time of colonialism and Cold War. So you could read that as you wish, but that's something we've totally lost. And if you look at the way that David Lammy explained the cuts a couple of months ago, he said, we have to choose. I've got the quote. We have to choose between the, quotes, compassion of internationalism and the something of, the hard choice of our national security. So there's a clear tension that's emerged, I would say, since the 80s in terms of, aid is charity and compassion, and it's not obviously in our national interest. We've lost that argument. If you look at the Pearson report in the 1970s, national interest and mutual interest, absolutely clear. And I could give so many other examples. So we have to unashamedly reposition international public finance, including for global health, as in the national interest of wealthy countries, it's not a bad thing to do things in your national interest. It depends how you define national interest. You know, the whole point of solidarity, people misuse the word solidarity sometimes as if it means generosity or compassion. It doesn't. It means doing things that in your interest and also in my interest. That's a good thing. So it depends exactly how you frame self-interest, though. So that's the first thing, it's about narrative. And the second thing is that it's not just about comms. So when I say we can't try and rebuild what's gone, you know, it's not just a question of commsing the product better and trying to revert to an aid world with a better narrative. We have to fundamentally change the product. We have to fundamentally change the way that we do international public finance. And that's around mutuality. So working together, reciprocity in decision-making. And crucially, the major difference between now, 2025, and 1945, of course, is that we need to build institutions that are appropriate for the 21st century in terms of voice and power. Now, that's going to be really, really hard, obviously, but I think we can be inspired by the way that previous generations did really hard things at really difficult times and succeeded in doing so. So that'd be my final kind of message of this bit. Again, let's not be defeated by the attempts of others to imply that this is the end of everything. It's actually the beginning of, I think, quite an exciting new moment, but will require a huge amount of work.
Thanks, Jonathan. I just need to spend a bit more time with you to absorb that optimism. But moving on to Andreas, and we'll pick up on some of the things that all speakers have said, but Andreas, over to you.
Yeah, thank you very much. So this is really a hard position that I'm sitting in now. I would like to give you a very, very quick overview of what Medico International is. It's first, we always say it needs to be said, it's a German organization, aid and human rights organization, based or historically in the optimism of the late 1960s. When it was founded, and also very closely linked to the solidarity movements in Germany, and then internationally in the work we were doing. And basically, over the time, our fields of work have quite extended from the traditional health work, into psychosocial work and human rights, migration, and climate justice lately. So this is something that also reflects a bit on the dynamic what we saw in what we call the social determinants on health, obviously, and the main way of working we are doing is through the support of local partners and organizations in a couple of countries, 35 at the moment. They're very similar to the work that I believe Health Poverty Action is doing. But what is really striking for me and different to Health Poverty Action is that we were not able to think about really dissolving our own footprint in Germany, but rather expanded it, and which also was a very different way of working, because being linked so closely to the solidarity movements, we have a couple of thousand supporters, not formally members of Medico, but who basically the basic funding from Medico and our work internationally comes from these people. So we are much less dependent on the public funding in international aid and relief than other organizations. So this which gives us a more room to maneuver, also to criticize. We are involved strongly, not only in individual work of partners, but also in networks and campaigns internationally. We have worked with Health Action International. We have a part of anti-apartheid and debt relief campaigns, Southern Africa. The Ban the Landmine campaigns were one of our like flagships work in the 1990s. We are part of the People's Health Movement and the Health for All and primary healthcare work. So this is something that makes that I felt what we have tried to foster among us ourselves with partners, that we collaborative work that is not so much framed in this tradition of giving aid or charity, but rather developing a kind of solidarity, as Jonathan said, that is very much about mutual interest also in changing the world to a more just, a more better place. That's basically what our thinking is about. What we see at the moment, and the big challenges I said, maybe one thing that would add to the talk of Michael Kipper in the morning session was that we try to really establish these long time partnerships with our partners, so not to do mosquito aid, as he explained the mosquito research, just jumping in, getting something load off or getting off and then being away again, but rather establish these kind of long-term relationships that would also challenge our own, of course, positioning as an aid donor with our partners. That's important. What we see as the challenges is not so much only that partners of Medico are cut off of funding by the US aid or UK or the German public funding that also will be greatly reduced for this year and probably the years to come, but also that we see that, of course, the whole infrastructure that we were critically supporting but also criticizing on the WHO funding will show a serious loss of structure that would be able to really bring the voice of and the need of people globally into a multilateral decision-making system that I feel is a very serious problem. Plus, and we are trying to engage also through the Geneva Global Health Hub, also with the counter activities against the authoritarian pushback on sexual and reproductive health and rights that we have seen, and this seems for us a bit like also a core of the work of the right wing and the right populist trend globally, not just and what we feel, and I think we come to that in the second round a little more, what are strategies, but just to say what Medico, I would say, over the last 5, 10, 15 years really has changed is that we are much more involved, as not so much because of a strategic decision, but as a necessity to be much closer to work also activists in Germany are doing, rather than being the experts on the global south that the tradition, like the traditional positioning of our organization was. So in that way, I think in the way we are drawn much more into our own sphere of policies, being migration politics, being the right-wing attacks on sexual and reproductive health rights and others. So maybe I end with this at the moment.
Thanks, Andreas. You've heard a lot of different issues. I think there's been a number of challenges expressed, but also expressed from slightly different standpoints of working for climate crisis, although we do see this as a polycrisis issue, which is all connected systems of whether we're talking about environments, economies, politics, or just the broader discursive shift that we are seeing today. I want to take before getting into what Jonathan, you did mention about opportunity in this moment of crisis, and I think a number of speakers have talked about it, before getting into what can change and what strategies are effectively working on the ground, I do want to open up for some sort of questions that people have. I also want to screen the Mentimeter for everyone to add to this conversation about threats. Can we have that screen or the slide? What we're listing a set of questions that we are also asking speakers that we would like you to contribute to. So if you go into this, we do want to hear a bit about the threats and the challenges. And a number of the challenges that have come up, I'm going to just throw it back to you, but also if there are hands that are raised, I'm going to pick, oh, wow, there are plenty. Okay, so I'm going to try hard not to take that space and give power away. So I'll come back with some questions, but over to, I didn't see the order of hands, so I'm just passing on to the gentleman there, and then over to Jude. Is that instead of a mic?
I don't know. Hi, I'm Adrian. I'm a PhD student in psychiatric hegemony. So I just want to feed back to Ravi, Jonathan, and Martin. I mean, it seems to me that we're circling around the issue of ideology, and let's say the counter-hegemonic project, which is the far right. They've built a relation of consent, the current state of affairs, and we are on defenses where we are losing a battle, and we have to find different ways of building this sort of consent with the people, with the masses, and trying to persuade. And obviously there is some sort of enjoyment that's it is at play when we're talking about the poor working class in Glasgow who are feeling some sort of gratification that aid is being cut. And I think that sort of aspect has to be properly researched. And the second point I would like to make is about neoliberalism and how it shapes, let's say, subjectivities. It teaches us how to desire. It teaches us how to demand politically, and so on and so forth. But I have a rather even more pessimistic view about that we are stepping out of neoliberalism and we are entering something called techno-neo-feudalism. Yanis Varoufakis, who's a Essex alumni, he wrote extensively about it. And I think it is even a more pessimistic perspective. And yeah, of course, subjectivities are fluid, identities are reshapeable, and so on and so forth. So that leaves an opportunity to act politically. Thank you.
Thank you. That was along the lines of what I wanted to say as well. I'm Judith Bueno de Mesquita and from Essex University, and my comment is in response to that, but also Ravi. And really, I suppose for me, the question is about communications, because we have this kind of, techno-feudalist space where, this is this sort of this alliance between the right and communications, and how do we challenge that? Because the spaces of communications, whether they're sort of formal media or whether it's sort of informal channels, are sort of so co-opted now by that agenda. What space is there for us or for others to counter that? And that's what feels overwhelming to me. Thank you.
Thanks, Jude. I'm going to add to this point because I think there's a really important thread around the idea of national interests, which can be progressive in ways. It doesn't have to be put in juxtaposition with the ideas of security threat and so on. But I mean, I think we're also talking about this move towards nationalization, actually nationalism, in the context of growing fundamentalism and control of the discourses by a select few. I mean, and across, so when we do talk about national interests, whose interests is it? And in that context of the fragmentation that we're seeing also in the community setting, our communities united in talking about and the resistance strategies, because what we're also seeing is extreme polarization, divisions not far away around the barge that got introduced here on sending migrants back and to Rwanda and transporting them there. The communities have been very divided. So the organizing task becomes quite challenging, and I will bring in the speakers here and what your thoughts are. Who would like to respond to what's already been said? I can't see all the speakers. I can only see Andreas. Okay, Ravi.
Hi. Yes, okay. And thanks, I think it was Adrian and Judith for those comments also. I think we all feel this emotional sagging given the way that things have been moving. But let's also, before I go further, let me just say what's also nagging on me. It's even in our own discourse, we're shying away from the idea that there are human rights and that health is a fundamental human right. You know, if we don't want to look at solidarity only as effective through mutual interests. It's not just enlightened self-interest. It really is a mechanism to keep people. It's part of the struggle. It's to keep people engaged in fighting for humanity and humanism in the face of power, because there's always going to be moneyed interests. There's always going to be political forces, and there's always going to be some segments of the population that genuinely do believe in a right-wing, patriarchal, oligarchic approach. And I don't want to spend too much time on the critiques, but we have to accept that that's the reality. But I think it's more just to shake us up and say, wait a minute, we are spending way too much time speaking in a comfortable language among ourselves and not challenging ourselves by speaking with the wider audience. And what can we learn from those who are successful in the moment? Let's face it, they get out and they motivate people. We talk about being a movement, and in many ways, we are a small number of people. But these political rallies, whether it's in Hungary, whether it's in India, whether it's in the United States, whether it's somewhere else, they are impressive in how they motivate people. And that's something we need to learn from, because we have not done it. We've not challenged ourselves to try it and to bring our ideas there, because those aren't simply motivating people. That's how these neoliberal or reactionary or right-wing leaders test their messages. And that gets to the point that Judith was talking about with communications, I believe. It's not just a communications challenge. It's also how are we going to connect ourselves with people? And communication is part of it, but so is the underlying issue. And I don't know that people have seen that we offer anything apart from what keeps us going, further and further analysis. So that's something that we need to challenge, and we need to resurrect human rights. I credit to Andreas, he brought up sexual reproductive rights, which are, I think, most under threat at the moment, as is gender in all its forms. We're not going to be successful by leading with those points, because people have already had the opportunity to make sure that they are protected, even as the world is constricting around them. Or they're really looking to see who's going to make sure that they can pay the rent, keep food on the table, and keep their children in school. And, by the way, also see a doctor, because that's how health is viewed, not actually being healthy. So we have to offer something more. And I think that's what we need to really take a look at. Then when we're looking at ourselves, we need to have this kind of big tent approach. And I hate to borrow that term, but we need to be able to say that, yes, we we believe in rights, we believe in a plurality of gender, but we also make sure that those who are questioning that, those who don't understand what we mean by intersectionality, can comfortably walk and interact inside this larger movement, because we haven't truly built that large movement. I'll pause there, but my main point is just to say that we need to take what's happening around us right now as a challenge to our own conventions so that we can move forward.
Thanks, Ravi. Anybody else wants to come in?
Okay, yeah, maybe I can continue with this. I think to share a bit also the optimism of a spontaneous mobilization. You might have read or heard about that in Germany. They were quite in the beginning of the year, when the last weeks before the elections, our Conservative Party did a really like a challenging move in trying to reformulate migration politics according to our right-wing populist in parliament. That there was a huge mobilization very spontaneously of people protesting against this, and this also brought the little left party that is still left in Germany also back into the parliament with almost 9%. So, but this is what I would say, like looking from our experience as medical international, sometimes I feel like that also has something to do with my age, of course, and working for 27 years here, is that what we see also in our work is a serious, as a challenging of the ways we have worked by a younger generation. There is a generational change. I think we need to acknowledge this and be very much attentive of and investing resources also in getting closer and transforming ourselves into solidarity, not just with our traditional networks and partners that are around, but really listening and being much more open to what's happening around us. That's why medical also started to move beyond the traditional health work into other fields, but more importantly also to see that we try with all complications also to see what to do with the new mobilization of on migrant identities within Germany, be it the Gaza protest, the Palestine solidarity movement in Germany, which is highly contested. And but this is something that we, as is like the established solidarity groups, need also to take into account. And so this is a bit my take of the current situation. What is necessary, that very much I think falls into the line that Ravi also was saying.
Thanks. I want to address both the contributions from the floor. So one point about how we're the emotion of it and how we feel, and then one point about communication. And it's hard. It's hard. I'm very old, very old, and you know, I remember right through the nuclear arms race, you know, when I was becoming politicized, the height of apartheid. It was the, you know, the sense, you know, really did seem at the time when Star Wars was being built by the Reagan regime that, you know, the academic institution I was part of at the time, the belief was, if it went ahead, we'd maybe got up the world, we'd maybe got about 12 years left. You know, it was, but I've never felt like it feels now. When you look around at the disintegration of the ability of the people to hold power to account in almost every country, when you look at the increasing inequality and the disintegration of I mean, the power of individuals just exceed, you know, going out of sight, you know, that and climate change, the clock's ticking as to how long we've got to address this. So when you get something that really knocks you, and for all of us, what we've seen these last few months, all of us, we felt knocked. I have, and I've had some real awful days. But the thing is, when I think about it, it's a couple of points. And one is, I mean, it's called these things are called struggles for a reason. And for me, as a white, male, straight, cisgender person with a privileged job in the UK, to look at what you see on the horizon, your possibility of a Farage-led government in the UK, and the thought of living under, and I'm not doing a very good job of inspiring that this second, but stick with it. So many of the people that I've tried in my life to act in solidarity with, that level of fascism, worse than that, far worse than that, is all they've ever lived with. But apartheid ended, you know, and so many of the struggles, things eventually change. And if you look at the situation that the Musks and the far right are in right now, immediately it's horrible and people are suffering. But when radical change for the better has come in history, the birth of that process usually happens when large numbers are suffering. It ought to be otherwise, but that's often when it happens. And one of the best things that we can do in solidarity with those, absolutely do all we can to minimize the suffering now and address that, mitigate it, but also make it count for something and use it to give birth to new ideas that will change the world for the better. And that's an opportunity that we've got right now. What Trump and others in the far right are offering isn't a sustainable offer, it's a lie. The people who are poor and voting for them, their lives aren't going to get better, they're going to get worse. It's not a sustainable story that they're spinning. We've got a time to build an alternative. And that brings me to the point about communication, I think. And I want to just briefly contrast two different campaigns. One was Make Poverty History, which was, you know, a huge, high-profile mobilization that I don't think actually achieved very much political change. I think it was a top-down, you know, celebrity communications-led initiative very largely. I was one of the organizers of it, so I can, you know, I can legitimately criticize it. I didn't like it very much at the time either, but I think it's, you know, so it had a, but I don't think it was a movement. And one of the things here, Make Poverty History, it had something like 5-page manifesto of changes that it wanted. When you read those, they were very radical. They were very good. But who read them?
That's because I wrote them.
Did you write them, Jonathan?
Some of it.
Yeah, well, they were excellent. They genuinely were.
Yeah, but no one read it. You're quite right. Best bits were dropped.
And the trouble is, when we mobilize a campaign, and I think this is one of the things that we often want to do, those of us on the left, you know, because we see the intersectionality of it, and we want to add in all, okay, but you got to mention this issue, you got to mention this issue, you got to mention that, you got to mention that, and the more you add, the more you take away your power. You know, for a movement, to build a movement, yeah, you need it, but for a political moment, for a political campaign, the more things you add there, the more you give those that you're targeting at the chance to pick on one. Yeah, I'm going to talk about that one. That's useful. I'll make it all about that. And all that came across to the large public, you know, they thought it was a fundraiser, Live 8 you know, and it gave the G8 a nice statement to say how much they were going to end poverty. The other campaign I wanted to mention was the Jubilee 2000 Drop the Debt campaign, around the year 2000. Now that, it doesn't necessarily feel it quite the same now, but that was a genuinely paradigm-changing campaign. Prior to that, the global consensus was countries' debts couldn't be cancelled, or else the whole international financial architecture would collapse. That it's all balanced on that fundamental concept that governments, countries paid the debts, they were honored. So you couldn't cancel debt. And yeah, $100 billion worth approximately was cancelled. And the paradigm was changed. And how did it happen? It took a campaign that originally was thought to be something that you couldn't build a popular movement about because it was too complicated a concept. And it was repeated education at grassroots, local level, to take that injustice that was just discussed on the pages of the Financial Times and make it the subject of a popular campaign, make it visible. That's a communication challenge. Now, Jonathan's concept of global public investment is very simple. Aid, it's about one country giving to another, pretending to be its benefactor when really it's stealing from it. Global public investment is a simple thing. All countries contribute, all, even the poorest. All countries benefit, even the richest. And all countries decide, all countries have a vote. Now, all kinds of complicated things can follow from that about how you build the architecture for it and so forth. But that simple concept, replace aid. We can get rid of aid. Those who don't like aid, great, we're their allies, we want rid of it too. Replace it with global public investment. That's a simple campaign. It's a thing that we can educate about. But I think it's the power, we've got a lot of the intellectual thinking done. We need to identify chunks of it and build them into popular single issue moments and campaigns, I think, grassroots education.
Thank you, Martin. Thanks so much. We already moved into the opportunities for change and what needs to happen. I want to hear from other speakers about some specific successful strategies that, or effective strategies, perhaps fairly localized, which can be brought to scale, or other ideas of how can we resist. We've identified 3 or 4 areas of problems. We've talked about the economic investments and the aid issue, not just with just the financing bit, but also the aid narrative. We talked about political and the environmental and the backtracking of commitments to climate gains. We've also talked about the fragmentation of both, I think, the approaches, but also organizing. And I think that the point, Martin, that you were raising earlier about political solidarity and practical struggle. And I think these are very interlinked in the experiences of MedAct, for example, coming out in support of the genocide in Palestine, and actively against talking about the public health implications there, has met with huge backlash, including among doctors, and complaints being lodged against the MedAct members of revoking their membership, the GMC registrations. So, I mean, we're seeing that very clear link of who is allowed to speak out, and then, of course, leading to self-censorship that we are also seeing. So just over to, Anna, do you want to come in with sort of the strategies, the anti-oppression work that MedAct works, or other ideas that you have?
Yeah, all the cogs are turning in my brain with all this discussion, so I'm going to try and make it make sense, but please let me know if I've lost my track a bit. So I think a lot of what we mentioned in the discussion just now, I was writing a lot of notes, does link again to what I was mentioning earlier around how MedAct has recognized the need to change our approach. So looking at our previous theory of change, which was let's generate evidence. These healthcare workers will use this evidence to then advocate for change. And that is subtly saying on behalf of communities, but then recognize when we're talking about the system that we live in right now, this fragmentation, this polarization, this world of alternative facts. I really hate this word, but it has come into the public lexicon. And that this is something that, what does this evidence do now? And is this the actual right approach? And I think within MedAct, we've recognized that this is actually not the right approach. And we've needed to recognize this, change it, have discussion with our members, have discussion with communities, and say, what is the way that we're actually impacting change? So we have then, from this instance, moved a little bit away to what we call organizing centered campaigning. And I'm gonna throw in a few definitions to try give a bit of an illustration, but When we talk about organizing, we talk about taking a specific strategic action on something. So it's quite specific and very centered on one thing. And that is very much what MEDAC would do in our past. And then organizing is very much mobilizing around mobilizing around a community, maybe not around a specific issue, but sharing skills with each other, sharing knowledge, and keeping that long-term community organizing so that whatever issues will come your way, that base is there, that community is there to interact, to engage and tackle, particularly when we're talking about when it comes to these health inequities that we are trying to tackle right now at MedAct. And what we've done is kind of then brought this together to say, the campaigning that we would used to do is actually a little bit what we're mentioning around acting on behalf of others. It's not actually engaging others. It's not actually engaging people that maybe feel the impacts directly. It is not really the solidarity that we're speaking with and keep throwing around, but actually we need to shift this approach to something else. And we have a few different examples of how that works. So I'm going to maybe give sort of a before-after scenario. So an example would be a group of doctors, which has historically been a lot of MEDAC's membership, organizing in a town separate from the local community against, for example, and again, this is just an example, it's not actually real life, against a new fracking project that is coming into place, or advocating for a change in housing policy. And again, that little bit speaking on behalf of community. And when that issue either goes away because we have managed to tackle that change, and that's great, or as that commonly happens with healthcare workers have burnt out because of limited capacity, as everyone knows the stage of the NHS, then that has gone away. And then we have shifted away from something else. And obviously that is not sustainable, that is not helpful, that is not working in arms with the community, versus what we're looking towards is healthcare workers directly engaging with the community, relationship building, saying what are the actual issues that are impacting this? Is this a priority? Sharing skills, sharing that health expertise and knowledge, helping them to identify these different links with health as well. And through that, sort of co-creating, working with them to say what are the things that we want to tackle. And anything that comes our way, we're able to tackle these things in solidarity through this long sustained group. So I hope that kind of gives an illustration of the differences that we're doing and kind of how that has, in our response to this polarized environment, this how we kind of view evidence and use evidence and sort of trying to resist this fragmentation. We have really tried to kind of change our approach. And I think I was going to say something else. But I don't want to take up too much time with theory. I think, yeah, I was just going to give an example, a real life example now that has happened, which we've been doing, as I mentioned, a lot of work on housing, because housing is something that is very easy to understand. Access to clean quality housing is a human right, and housing does very much impact your health. And so what MEDAC has done, after being contacted by local residents of a housing estate to say that our housing quality is so poor, there is mold everywhere, things are breaking down, our association, housing association is not listening to us. And so MEDAC has worked together with the community and sort of helped bring perspectives of health, help them see the interlinkages, the right, how this mold is exacerbating certain health conditions, helping write reports with the community. And again, it's not MEDAC coming in saying you should do this, okay, we'll go away now, but actually working with them. And now we've had some very successful indicators of kind of from that project, but the housing association actually saying, okay, we will dedicate money towards this, we will have actually someone on in this estate that will do repairs. And I think the idea is that this community is now so strong, and now other estates within the same housing association are now organizing as well. And this idea that sort of collective community local action and that healthcare workers working with this is this reimagined solidarity that we are looking towards, not this maybe old, oh, healthcare workers are very trusted, we're actually talking about doctors, let's use this evidence to enact change. And I think I kind of want to cheekily answer them the question discussion that we were talking about as well, when we're mentioning comms and when mentioning solidarity with others and fragmentation. And that does very much link to comms. And I think there is sometimes this risk that we love to go theory first. I personally have been working in the access to medicines field for a long time, very technical. You're dealing with intellectual property in medicine, which is incredibly, you have a lot of the technical words, but obviously it's something such a basic human right and needing to communicate that with others. And I think there's a lot of discussion and movement organizing that you never win when you go theory first. And there are a lot of things that we I will admit in our own circles do love to use very technical knowledge that will lose a lot of people. I think, what was it, techno-neo feudalism? I've never heard this word before. I will definitely need this explained to me afterwards. But I think Ravi had spoken around sort of when somebody comes into this movement, recognizing housing is impacting my health, or actually recognizing the other interlinkages of health that they're being impacted with. We can't throw theory at them. Thinking about these comms, we actually want to build solidarity with them, and we want to work with them to build up this community so we're stronger to impact either current issues that are happening that will impact health inequities, or that spread health inequities, or anything that will kind of come in the future. I hope that answered the question.
And I think the campaign is called Mold is Political, and it's really a very strong campaign and connecting and using housing as social housing as an entry point to talk about larger issues. Thanks, Anna. Praveen, do you want to go next about just strategies, opportunity?
No, just so that's good. I haven't got a question. So first thing, Martin, isn't it? Martin, change only comes from difficult people who actually upset the status quo. And I think it's absolutely remarkable. First of all, we never thought Trump would get in the first time. He got in a second time at a time. We thought never, ever would he be there. But there he is, and he is perpetuating and talking about things that really we are all against. Yet there he is, has been voted in by most of America, well, you know, the vast majority of America, which is extraordinary when you think about it. So somebody was looking for a change, and they got the change they deserve. But overnight, he has changed the whole of the economics of the whole world. And I suspect probably America won't do that well out of it. If you read The Economist, which is out today, yesterday, it would be quite a useful thing to do. So what are we going to do? We talk about, or I think Ravi was talking about a big political, movement and so on. They can happen. Our cause isn't up there in the front. Nobody seems to hear about it. We all go around now. We're doing things like, have small stand-ups with, people, stopping roads and blocking this. Well, that only turns the public against us and takes away the idea of the cause of why they're doing it. And we really need to somehow get this idea that climate change is here, the world's going to change, you're not going to be around. And I think if we could tell Mr. Trump that in fact his children are going to have problems, he might rethink the whole game. So I think we need something to catalyze change. And I think this can't be done quickly. I think people not in the health area do not understand what's happening. And maybe that's a fault of the medics, and maybe it's on the health profession. Maybe it's a fault of all of us in our different areas that we've been working on. So I think if you want change, we first of all want good leadership. And if we haven't got good leadership, then let's forget it. But there's a huge opportunity. We've got lots of leaders in this room. I mean, I think that'll be brilliant. But we need a vision, and we need to know how we want to get there, why we want to get there, and where do we want to get to. Now, if you can have that vision, get the leadership, and then sort of work on all that. And you can't have it top down again. It's got to be bottom up. So you've got to involve people, you've got to involve communities, you've got to involve individuals, and let them take it along with us. They've got to have the impetus of doing it for themselves. And I think I agree, let's change the word aid. Let's have a sort of a public, a public fund maybe that they can go about and do. Secondly, within this, you need to build a supportive community that can actually talk to each other, work about it, and actually have that vision. And if you can't get that, then again, forget it. I think we're forgetting we all need to be adaptable. We need to be flexible. And we need to be so flexible that take whatever we want to take. It may not be the right thing, but it might be leading to the right thing. And I think that this is really, you cannot get there straight away. You've got to have small incremental steps getting there. So we can't immediately say, right, guys, this is what we're going to do. It's got to be done from the bottom up. So, and I think the last thing two more things I want to say, we've got to be persistent. We really have to keep on bashing at it until we get there. And then the other thing, that you're not going to get anything done unless we have data and we review that data, we have the feedback, and then we rethink, we have a loop back again and say the evaluation, and this is the right thing to do from the research point of view. So there are lots of things to do. Can we get there? The answer is maybe. I'm not quite sure. We're going so slowly and things are moving very fast. And people always say, well, maybe AI has the answer. Well, AI can do a hell of a lot, but it can't do everything. And, you know, some people have told me, well, don't bother about global health. You know, we will have sorted out, AI would have sorted it out, you know. But it's not, it's bigger than AI. It's the whole world, it's the planet. And we're going to lose it. On that this really sad note, I'll hand back to you. I don't know what the question was, so I'm not sure what I answered.
Thanks, Parveen. Those are really good tips and values to keep holding on to. I'm just checking if there have been questions on chat box, and if those are something you can read. I'm also going to now invite Andreas or to respond to the question about the specific strategies that are working to build that change. Andreas, are you there? And can we have the speaker view? Andreas? Anything you would like to
add? Yeah, as I shortly said already, I think what we try to do is indeed trying to reach out much more to like organizations, networks outside of our traditional bubble that we did. Like we have a coalition. This is defending the migration society as something to counteract this narrative of you could go back to some kind of nationalist understanding of what is German or who is British, and so this is something that we see. I think is a major point to make, and then also trying to counteracting this inward-looking trend, isolationistic, or you could isolationistic, to name it, and then also what would refer very much to Anna's work, what she said on how MEDAC is working. I think to really being closer to the traditional, like I said, bread and butter issues of your society, so that you are not just felt with this or falling into this trap of saying, okay, we have to divert funding from like either we can increase the we can increase the social insurance money in Germany, or we give it to Peru to build bicycle lanes. This was one of these big examples, very similar to what Musk is saying, to say, okay, these crazy USAID people give millions of condoms to Gaza. So to understand that people, of course, and then it's not just, and particularly also because we as the institutional structures are not the ones who are fighting for finding, sometimes we do, but hardly are the ones who are fighting for our subsistence and getting our kids to the cinema or to the school outing financially. So in that way, to really understand also the privileged position that we come from, but to make very clear that we have a solidarity approach, not just with other people over there. I think this is a center strategy to really understand that we are much more concerned, which for medical, for example, would also mean to be much closer to things that happen in our city, in Frankfurt, where we are, rather than because of our limited resources to be part of these like federal networks and coalitions. But this is something that I feel is absolutely necessary beyond, and also what I said. Maybe the second thing is really try to bring your own expertise into these local debates. So our campaigning to deal with the right-wing radicals, to even get them maybe the party prohibited, to add our knowledge about the international networks that right-wing parties are involved in. So how much they are involved also with the Argentinian Milei and the people in Hungary and Russia. So to make clear that this is not just a similar German thing that we are debating, but it's rather a global issue. And I think this is an expertise that we as international working organizations can bring into our local struggles. And that's what I feel is a good way to do this connection.
Thanks, Andrea. So both points about, one is community organizing, but also links with other organizations, networks, mobilizations to build that solidarity. I think this also speaks to one of the points that you shared on the Mentimeter from the audience about that we have not been good in organizing. And we, when we're commenting on the ways in which the far right is organizing around these issues, I think there have been fragmented approaches within the left organizing and not reaching to the communities. I do want to pick up on one of the points that was raised earlier about the neoliberalism and commercialization. In particular, Ravi, you do talk about the public-private partnerships. And one area that I've also written about in the three-part decoloniality framework for global health is that we are not adequately touching upon the commercial exploitation and extractivism in our decolonization debates. And I think one more contemporary form of that is also how high-income countries, UK, European institutions, and their development finance initiatives are also transporting these models of public-private partnerships in health and healthcare systems to international contexts and the growing economies and with money to spend on healthcare. And that really demands ideas of accountability to come center stage when we're talking about this alternative vision. Any strategies in both from Jonathan and Ravi that would be effective in also holding state leaders to account okay, there is a 8 minutes notice shown to me, but in holding leaders to account on these international development finance initiatives, blended financing and private equity going into the healthcare systems, while we are still struggling with the desecration or evisceration of our own NHS healthcare systems, we're also transporting these PFI models to international context. So what are the issues around accountability or and commercialization that you would see some effective strategies around? Over to Jonathan or Ravi. Ravi.
Yeah, you've put me on the spot on it. I can't say that I got this strategy for us, or even the notion of what the real next step would be. You're correct. This is going back to the conventional neoliberalism before the past few months and years, in which public-private partnerships were put forward as a means of ensuring that the state was kept from providing public services, whether in health or education or transportation and so on. And this financialization of public services that's again, I go back to the idea of the narrative. It's seen as something that we need to do. And we've had good debates even here in Kenya within civil society, where there are some people who say, no, the government is inherently corrupt. It's always dealing with the back door. There's cartels in the ministry, and that's very true actually in the Ministry of Health, and therefore we need the private sector. And then others of us are coming forward and saying, the critiques you have of the government are that it is actually serving the private sector. Then we can look at the conflict of interest that really comes up And what we need to do is, as you pointed out, Anuj, is ensure the accountability. Where I am stuck right now is that with all of the changes happening, accountability mechanisms are being destroyed. And that can be free and fair elections, that can be the rule of law, going to the court system, turning to constitutional provisions, let alone international instruments. So I believe that right now, I'm open to a wider discussion, and maybe you've catalyzed it with this first series of discussions. We need to see what can we do now in the moment to protect our peoples and ourselves and ensure that this extremist ideology doesn't run too far. But let's also prepare for a time when it also falls apart. It does have its internal contradictions. Several of us have pointed that out. And Martin did so, I think, quite well. What can we do so that we can rebuild a modern accountability system for the future? Something that's designed for the mid-21st century rather than something that builds on the mid-20th century. And I think it was a very good point that was made, I think, about the destruction of the Bretton Woods institutions, which is something that, you know, even if it's the right wing that's doing it, we on the radical progressive side wanted to see between reform and reconstitution of those kind of enterprises. We're headed in that direction. What can we do to start putting forward what would a new global system look like? That's looking too big picture. I think we need to start very much at communities and see what works. That's not even close to an authentic answer to your question, Anuj, but that's where I am.
That's really helpful. Thanks, Ravi. Over to you, Jonathan.
Okay, let me try to do a couple of very big picture things and then try to answer the question about what strategies we need. So I do think there's a defeatist attitude, and I do think I'm going to say I'm really provocative. I think people sitting in the north right now, I mean, I'm of the north, but sitting in the global south. I think people sitting in the north right now are really depressed. I actually think that's a lot to do with what's happening in northern countries. So it's massively depressing what's happening in the US, what's happening in the UK. Germany's like exiling anyone that speaks up on Palestine. I mean, it's crazy and really worrying, a lot of the stuff that's happening in the global north. I don't think that vibe of depression and gloom is the same in the global south. In fact, I would say that there is even a feeling of optimism and opportunity. We have spent our working lives trying to end US narrow imperialism. We now have a government of the US that accepts that the empire is ended and that is reducing its attempt to run the world. Like, there are so many, like the Trump thing is a response to a context. The underlying trends there are as many positive underlying trends right now as there are negative underlying trends. And I'm not trying to undermine or the very powerful negative underlying trends that exist as well. We've just got way more on trade in the last couple of months, but the other ones are on climate change, the fears we have about what AI could do, the power of oligarchs and rising inequality, what Ravi talked about accountability and autocracy rising in many countries. That's all true. But the tenor of this conversation has totally left out all the hugely positive trends that you can see also in the last 5, 10 years, and that are continuing today. Most obviously, like I say, the rise of global South power, which is something that will define the 21st century. And I think that one has to have a historical perspective here. It's hard to step outside of the very grave challenges that exist in the moment. But when you take a historical perspective, there are equally as many opportunities and things to be proud about and things to celebrate at the moment. Human rights, absolutely, Ravi. But we have, one thing I agree with the right about, they think we've won, right? They're really angry because they think the last 40 years have been a huge success for liberals and progressives. And on a lot of stuff, they're right. Yeah, women's rights, human rights, racism. Yes, we're now facing the backlash. We have won so much on global health. Look at the global, you guys are the global health experts. Look at the global health statistics. Astonishingly better than they were 50 years ago. Right, and that's not necessarily a liberal thing or an aid thing. That's just, whatever, a whole bunch of reasons for that. But I think we probably need to celebrate what we've achieved, and we need to put these battles that we're currently losing, absolutely, we need to put them into historical perspective, and we need to see the opportunities that exist. It's, apart from anything else, it's a respite from the hypocrisy. I think a lot of people in the global south are relieved when they see Donald Trump talk. Because like, finally, it's a respite from that endless hypocrisy that we would have continued with if Biden had won or Kamala Harris had won. And actually we can now see things for as they are. I mean, this is a much longer conversation, but I would urge you to to view the current historical moment in a slightly more positive light. And then what do we need to do? We need to do two things. From my perspective, we need to invest heavily in a new narrative about mutual interest and human rights and generosity, but mostly mutual interest, because while we do need to insist on being right about human rights, we also need to be politically realistic, and we will not get northern countries to support large-scale international public investment based on a language of reparations or obligation, or based on a language of charity and generosity, however much we think about that, or based on a language of human rights. We have to make the case with evidence, and that's where the academics come in, that this is in the national interests, long-term maybe, sometimes direct, of countries of whom we are asking large amounts of money. And not just money, by the way, but better trade rules and all that kind of stuff. So invest in the narrative, and secondly, take advantage of the battles that are coming up. I work in international finance, so there's the financing for development thing in Seville in about 3 months' time. These are opportunities. There's a World Summit on social development coming up. There's the COP in Brazil. There's the South African G20. These are all opportunities where we need to, it's no good just having great rhetoric and great speeches. We need to win specific battles to get things back on track for a new kind of multilateralism led by the Brazils, the South Africas, the Colombias, who, by the way, are feeling energized in UN processes now, in precisely the way that your classic, Sweden's and the UK feeling de-energized because their world is changed. Other countries are feeling really energized about trying to do something impressive. We've hardly mentioned China, clearly also the crucial player in all this. So identify winnable multilateral battles and start to change back the narrative, is what I would say.
Thank you, Jonathan. I would leave us on that optimistic note. I mean, I think the pessimism also comes from being from the global south and working in the global south and what we're seeing, but completely agree with you. And there are a lot of comments on chat, but I'm conscious of the time and we've overrun slightly and we want to bring this discussion to a close. I think two big strands that have emerged, and please do come in if there is a third, is a stronger and a different, more radical and transformative approach to community organizing, which is really starting with community connections and not imposing other agendas and specific positionalities. The other, and of course, building global solidarity by moving outside our echo chambers and connecting with both alliances, north and south, as well as other organizations working on, or allies that are working on social justice and equity issues. And the second aspect, which is at the most sort of global and policy level, is investing that heavily in that narrative around new multilateralism, identifying allies and seeing how the global governance structure could address the democratic deficits that we've been writing about and speaking about for a very long time now, for 2-3 decades. Perhaps this is the time we shift the dial. I would welcome immediate sort of reflections or thoughts on this before closing this panel. And okay, so we have one here. Any other thoughts? Please be brief. Over to you, Ashish.
I'll be very brief. I just wanted to point out what's recently happening with NATO and compare it with health. Look at defense and health, two biggest expenditure worldwide are defense and health. Europe for a long time, over 30, 40 years, subsidized its defense and prioritized social care spending. NHS, etc., were big beneficiaries of that. Now that is coming to change. Germany, like everyone mentioned, has brought about a huge change in its economic funding. As we look into the future, and that is something that system thinkers are talking about, you have to make trade-offs. So you're looking at defense, you're looking at health. You can't have both. So if you're looking at a very big macro picture, those are the trade-offs that you'll have to think about. You know, social care spending, defense, social care spending, health. And you can't have all of them. This is just a point that I wanted to make as a systems thinker. I'll leave it to you.
Okay, thanks, Ashish. Colin, did you have your hand raised? Yeah.
Just a few comments. First of all, I think it's bizarre to say that US imperialism has ceased. I mean, it's just simply moved the target to places like Gaza, Canada, Greenland, Panama. The positive proposal I would like to make is something that I don't think has been mentioned. I think one of the big factors in dealing with this, the narratives that we've been talking about, is education. When Trump was on the campaign trail and he frequently attacked education, he said that, you know, universities were bastions of quote unquote lunatics and Marxists. And he also, and J.D. Vance has said several times that universities don't act in the national interest. So what I would say is I think a lot of people have gone for this populist or fascist, basically, narrative, in part because of a lack of education. And that we haven't invested properly in education. Education in this country has been pared down vastly. I mean, students get what? 8 hours, contact hours a week. There's mountains of bureaucracy, but very little actual education. So I think education is a big factor. And I think that's something that really should be looked into. Yeah, I mean, Trump was it. I love the poorly educated. Was one of his statements. You know, he was insulting his own voters. but it's because the poorly educated will actually go along with this fascist project.
Thanks, Colin. Can I have any immediate comments from those joining online audience? Okay, there are quite a few comments. I'm not going to read all, but can we scroll down? Or if audiences could just raise their hand, a virtual hand, and then I can invite them to speak. Just some comments. Are we able to screen those here? Are we? No. Okay, so comments from Jane, Hannah, I'm guessing that the poorest population who support stopping aid and support reform are thinking that they do not have enough and so don't want to give to others. A response from Ravi as well, or people may not be looking at the transactional aspect, but simply looking for change. Meaning if previous governments had truly served their own marginalized peoples, there would be support, solidarity for more such action globally. I think there is a reference to the optimism from Mukul about someone who has worked to reduce global LGBTQ plus health inequities. I'm curious to understand how one can change the narrative around international development aid being in national interest, given the rising queer-phobic rhetoric within nation states of the global north. Sorry, Mukul, I know you're feeling miserable about this. And I think that takes us back to the question that audiences had also put in, that we really need to invest in EDI. And by EDI, I'm hoping that what we are talking about is not the sort of tokenistic representation it has taken in many neoliberal institutions of enhancing representation itself, or bringing that Black person to these forums, but really a structural transformation change for addressing some of the oppressions that are underlying those issues. There is also just some compliments for good presentations and the much needed conversations. I'll leave I'll just read the last comment. US imperialism is declining in power. This is a positive trend to build on. And I want to leave at that note because I do feel that there are very hard battles to fight, and there are, but we'll have to be selective. I do feel these are only conversation starter, and we do need to meet more frequently and in these spaces, but also amplify these dialogues in other spaces to be able to connect with the issues that we are seeing today. With that note, and on that note, I really want to thank the speakers who have joined us online and here in person from London and other parts of England, for the very provocative thoughts, for really useful, effective strategies, and sharing the on-the-ground strategies that are being adopted, which I'm hoping we can learn from. And I think amplifying these in more international exchanges, where we can learn from other battles and struggles in the global South. And we have a lot to learn around strategies of resistance in countries that have experienced this kind of oppression for centuries. So on that note, thank you so much. Can I have a big round of applause for all the speakers? Thank you. And thank you. I do want to bring to the next session, the closing. Thanks so much to the speakers. And I want to invite Professor Winifred Ibo, who is the Dean of the School of Health and Social Care, to join us and do the closing remarks. And then I'll share the clever plans of where we are going after. Just for the people joining us online.
Thank you so much. I can see a picture of myself and it doesn't look quite like me anymore, but anyway, it is me. Thank you so much for, inviting us here. And I just want to really say a big thank you to all our speakers. I know that people have traveled or have come from all over UK. I know we've been joined from people from South Africa, Germany. And I think Essex is privileged to have you all here today. What a shame it's a Friday, because the campus is really quiet, but it's nice and sunny and warm, so that's brilliant. I want to also thank Anuj. She's done a lot of work, a lot of hard work to pull this together. And of course, her team. I think the University of Essex is renowned historically for speaking out. And I think this is a befitting program to have in the University of Essex. So a big thank you to Anuj. I'm sure you want to give her a clap and say thank you. Anuj and I always have a real battle fighting on behalf of the global, I would say, majority. And the issues around health and inequalities. And I think this today really pulls together such important topics, looking at decolonizing human rights. And I was listening to the gentleman, I've
forgotten your name. You just hit the nail on the head when you said you're too old. I don't think so. But we've seen such a change in the climate, and what seems right is now wrong, and what's wrong is right. And I think when we get a group of people together like this to discuss really important issues, it's critical that people listen. I hope we can use the recordings from today and some of the materials from today to help in the education of our students as well. Colin, you made a point about education. You know, quite often people underestimate the power of education. And here at Essex and in the School of Health and Social Care, we do have a global public health program, which Anuj leads on. And it's really important that we really support Anuj in ensuring that the next generation of scholars are actually speaking the language which is not necessarily welcomed, but needs to be said. Anuj has also been a pioneer of the GEMS project as well. And I've been very privileged to chair some of the projects that she's doing with her students, and the amazing work that they're doing looking at marginalized groups and what the plight that they have in health and accessing health. I just also want to look at the political landscape. I hear the word Trump mentioned. I say we hear about corruption and how this is perhaps impacting some of our global majority. But having grown up in the UK, I don't think any of us should be pointing fingers. We need to look at where corruption comes from and who taught us corruption and how it's impacting on health. And the narratives, depending on where the political power is, where the narrative seems to shift, depending on who we're supporting at the time. I also want us to really support Anuj in developing the center. I think the center is a really important place, and we have spoken, Anuj and I, about providing some sort of scholarship funding for students or that have finished their program in global public health to take it to the next level. It's really important. It's not just educating, but actually implementing and supporting that implementation. So we are in the process of pulling something together to ensure that that is continued and supported. I don't want to keep talking. I don't talk very much. Well, I try not to talk very much because I know today has been a really long day for all of you. But I just really want to extend a massive thank you to Anuj and all our presenters. When I look at the list of presenters, I mean, I think, what am I doing here? So much expertise, so much richness of discussions that have gone on today. And unfortunately, I couldn't be here this morning. I would have really loved to be here all day. But from what I heard when I came, amazed. I'm absolutely amazed. And thank you so much for all what you've done today. Take care. Thank you. Safe journey home.
Thank you, Winifred. Again, a huge, huge, huge thank you for making this day possible. And I really cannot leave the room without acknowledging this brilliant team who's been working, who's been communicating with you behind you. Rufan, Rumi, tech experts. Okay, what is that? And Rebecca, who has been a volunteer for today, has also been taking notes, and we will be sharing some synthesis from this. And what we are hoping to develop, will be starting the development of, is a global health manifesto for the reimagined global health and global solidarity that we want to talk about. So we will be in touch. And of course, you please feel free to leave your emails and let us know if you would like to sign up for updates from the center and its events. Most of the events that we will do is in partnership with all our different partners. I mean, Winifred mentioned GEMS. I co-direct that with Joanna, Joe Berry, I never, Joanna, with Joe Berry, who's here from South Africa. So other collaborations around the decolonization debate, I already mentioned, Paul, Human Rights Centre, HPA, MEDACT, some fantastic work that we've been privy to and are continuing to learning from People's Health Movement Chair and trustees of both organizations. Thank you, everyone. I want to bring this to a close. Again, it's beautiful, sunny outside, officially spring, and we will be going to have drinks in the Students' Union bar, and then the other plans will unfold from then. So please stay tuned on that. Thank you so much, and thanks, Vanessa. Sorry, I'm being shown, what is this? Oh, thank you, group photograph, and then SU bar. Okay, thank you. So that's, you know who is the chief whip here, apart from Milena. Okay, can we all step out? Do we want it out? Where do we want the photograph? Rumi? Outside. Outside, okay, can we step outside? Thank you. And thank you everyone for joining us online, and I know across time zones. Have a great evening. We'll be thinking of you all while we have a drink in our hand. Bye-bye.